by Assistant Professor Dr. Muhammad Faiz bin Tahir. So this is the scenario given to
it seems that our presenter is being disconnected. I'm not sure why. So do we have a backup from the team? Any other representative from Group 9? I'm not sure whether, I'm afraid that she's not aware that she's been disconnected from the Zoom. So I need any other, other team members?
I think if Group 9 is not ready, then we can proceed with Group 10. Group 10, okay. Are you ready?
Okay, wait.
Okay, you are from Group 10, is it? Okay.
Yes, boss.
Okay, so proceed. Please proceed.
Okay, Assalamualaikum to professors, lecturers and colleagues. I'm Akil from Group 10. We'll be presenting on our scenario on topic for discussion here. Our supervisor here is our Assistant Prof. Dr. Muhammad Saiful Ihsan with our team members of Aina, Naveen, Shazlin, Fidaus, me and Nadia. So our first scenario is actually patient requesting antibiotic for his viral acute tonsillitis, and then you have informed the patient that it is not indicated. However, patient still insists. So how to resolve on this issue? So basically from this scenario, there is an issue to be addressed is medication that is not indicated, and then there is a bit of argument and disagreement between this patient and doctors. So on this first scenario, exploring further on this condition is actually whether the patient concern itself on the need of antibiotic for treating her condition or his or her condition. And then actually why does this patient need the antibiotics? And then whether this patient still understand about his diagnosis and problem. And then as a doctor, we need to explain regarding his sign and symptoms suggesting the diagnosis of viral acute tonsillitis, in which the antibiotic has no role in treating the condition. And then we should explain the common symptom of viral infection, and then explain regarding the treatment mostly is supportive rather than antibiotic. And then we need to give the assurance to the patient regarding his condition and current management. So here's on pointing forward, if we go for patient-centered medication, we need to explore regarding whether the patient understanding of the problem and disease, and then whether patient understanding about the medication for the problem, and then need to explain patient regarding the role of antibiotic, regarding the diagnosis, justification, and treatment for the condition. And then also in regards of principle of going back to principle of Tawheed, we need to explain again to patient regarding the principle of causal and effect, and the concept of itia and tawakkal that must be in concordance with the causal and effect. And then we need to give the assurance to patient regarding our treatment. So we should explain to patient benefits and harm of the antibiotic and explain the risk of unnecessary medication. Example of regarding of consequences of misuse of antibiotic, which is the most that we're afraid of are the promotion of the antibiotic resistance, where it can cause more serious illness later on, will take longer for recovery period, and then frequent or longer hospital stay or later on expensive treatment, causing wasting, and then also can contribute to other infections such as the Clostridium difficile. And then also the antibiotic role in her condition actually won't cure the infection, and then won't keep other people getting infected, and won't help patient feeling better, and also even can cause harmful side effect. Furthermore, we need to tell the patient that our regardless, our door is always open and we will monitor the condition, and we should emphasize on condition in which the patient should come and seek further treatment if things not going as what we wanted. So back to a bit of Fiqh Muamalah here. It's a bit of doctor-patient relationship. In regards of this doctor-patient relationship, one, we must understand our role, which is one, justice. That is, we put everything in order or place correctly, with no purpose of additional suffering from us and benefit to us while giving the treatment. And then we do in our best ability, following our understanding, along with the continuous update on recent knowledge in order to provide a good treatment. Otherwise, we must be polite as a part of Hablum Minan-Nas, as part of relationship, maintaining relationship between us and other human beings in order to gain Hablum Minallah. So, and then also we must go amanah with our management, giving our best in doing our job and treatment for the patient. Here, a bit of partnership concept need to get through following the Fiqh Muamalah. This is the concept of Muamalah itself, and then also as a patient-centered medication, we need to give guidance to patient. There is a patient-centered management where doctor and educator, we aid the patient in decision making, especially in getting consent and further treatment of their condition. So in regards of Fiqh Muamalah here is actually a form of mutual dealing held between men to solve everyday need, including trade and commerce, social relationship, economic and non-economic activity. It's actually still following the Maqasid Sharia framework. There's a formulating decision to resolve the conflict of interest and dispute, weighing wants and benefits, and following the Islamic principle, where to ensure human well-being following the religion, life, progeny, mind, property, and dignity. So in this condition, we try to preserving the life in order so the patient can go preserve the religion, progeny, mind, property, and other condition. So if we we see back the scenario following the principle of Tawheed, we need to emphasize this to the patient that this is a Sunnatullah fil count and causality, where there is a causal and effect for everything. And if we want to go for ihtiyar, you must go in concordance to the cause towards the condition. And then ihtiyar must be in concordance with the cause and for the treatment. Otherwise, we must also remind patient of the qada and qada that can be happen, that is the predetermined from the early on. So in here, in regards of Fiqh Ibadah, it's actually as part of our job to treating the patient, and it's our ibadah to us if we ikhlas and do our best to the nature and refer back to Allah for everything. So in here, still following the framework of Maqasid Syariah. So in regard of this scenario, in establishing problem, so we need to understand the patient concern and opinion, and then we need to explore and further discuss about the patient and explain to them regarding the matters. And then we need to remind them of the principle of causality, which is the benefits of treatment and harm of unnecessary treatment, also indication and harm of medication that are unnecessary. And then as a doctor, duty and partnership concept, so we must educate the teacher, being a teacher and lecturer to the patient, and then we must remind them of the concept of qada. And also at the end of the day, we try to aim for the well-being of the patient, especially in health, wealth, religion, and others. So in dealing here, we think that the Prophet role model is a best example in dealing this condition, where we should be a leader that lead patient towards the decision making for his condition. And then we need to give example by giving a good moral things and explore the dispute disparities with good manners. And then we need to nurture to patient health condition, and we call to righteousness back to the religious state. And also we must be keeping our good relationship with the patient. Okay. Regarding our second scenario, this is our second scenario, is a patient suddenly enters your room and angrily scolding you for a long waiting time. So how to settle the issue? So in here, from our group discussion, we see there's a issue here of an unsatisfied patient, basically because of the waiting time. So patient is in the anger state. So one, we need to establish the problem itself. So we need to approach the patient and establish the problem. What is actually the patient needs here, patient urgency and need currently, whether it is really emergency and they cannot tolerate waiting time, or even there's also we must see other patient issue also that we need to be addressed. And then also in time we need to see what's the cause of the long waiting time. Is it maybe due to our long time of consultancy for each patient? Is it a unnecessary chat, or whether the queue is actually took a long time? And then here we need to understand our role and punishment concept. So in handling this, we must remain calm and don't fight anger with anger, keep our emotion in check, and then we need to have a good communication skills, keep our emotion in check first, and then allow patient to address the issue and discuss middle solution. If it's the waiting time because of emergency, patients think it's an emergency situation, maybe we can divert and address them urgently, or we need to divert to another emergency setting, because sometimes we don't know what's the issue that causing the patient to be anger. And then also we must understand professionalism and ethics. So we need to bear in mind, we must provide justice to all, not even to the unhappy patient condition here, but also towards the others that are waiting in line to be seen by doctors. And then we must maintain it well-mannered and handle things well. And then also we need to protect our dignity, our sanity. We need to keep our anger. So as a protection of the, and then also in protection of health, we need to assess the situation condition, whether this patient must be seen urgently or can be wait. Then also we need to consider whether need to ask for help from others, especially the security, if the condition is getting worse.
Brother,
yes?
you have less than 1 minute, so can you sort of wrap it up? Okay.
All right. So here's the second scenario. So basically, roughly in handling, stay safe and involve other staff if feel threatened. Don't respond with anger. Identify the cause why patient is angry. Acknowledge patient anger and have good communication skill. So, and then we must explain to patient regarding the delay that they're facing, pursue solution and ideally apologize, and give reassurance to patient the step that will be taken to improve our service in the future. This is a bit of tips on managing difficult interaction. So we need to plan interaction in advance, pay attention to non-verbal communication, discuss with colleagues, and do not hesitate, seek additional training. Look for sign of anger and distress, ensure safety and maintain control, create breach of communication trust, explain difficulty and try the common ground, help your patient get emotional control, and focus on highlighting solution and resolve area of disagreement. That's all. Thank you.
Okay, thank you very much, Brother Akil, for nice presentation. Alhamdulillah, you managed to cram everything within 10 minutes. So, first and foremost, I would like to welcome to all our expert panel for today. Today we have Dr. Hamidun from Centris. Then we have Prof. Aminuddin, Prof. Ibrahim Shogal, Ustaz Abdul Rahman, and Dr. Osman Jaafar. So, without further ado, I think I would like to invite Prof. Aminuddin to give some comments or what his takes on this topic. Please, Prof.
Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Jazakallah khairan katsira. I think, Brother Akil, I come a bit late just now, but I managed to listen to the scenario too, at least. And then I think what you have given us actually is the step-by-step how you are going to manage, especially in terms of the anger management, which is a very common scenario in the clinics. Whenever patient waiting for a long time to see the doctors, and then it is become worse when we don't have enough doctors to see the patient as well. And then this scenario is not new, and then it's happening again. And then this one, the only thing, the most important part, we should know how to manage it accordingly. And then most important, I think the most of the things that have been mentioned by Dr. Akil just now. The only thing is the way that we are conveying or we are sorting the patient, the anger patient, actually is there is a way that sunnah that we should actually is make the condition actually is become calm, better for us to talk to the patient. And then somehow maybe in the busy clinic we have to get the patient, bring the patient to somewhere which is quieter, and then sit down, give her a bit of water, and then ask what they. And then the most important actually is the technique of the active listening. We have to listen to what the patient problem, and then try to sort out. Maybe we can't really resolve the problem. We can't really let the patient jump the queues, everything, but somehow it's a consult, or we give the patient the reassure how it is, because most of the patient, they don't really understand what's happening. That is things. Okay, thanks. That is my comment in terms of the condition, which is I think you are applying a lot of the principle just now. The only thing is the practicality, the paradigm of this thing actually is a need to be really looked into how practically you have to do it. Okay, thank you.
Thank you very much, Prof. Amin, for your insight. Yeah, this is something that I think most of us encounter almost every day. So maybe I would like to invite another panel if you have any comments.
Yeah, maybe just I can. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum. Please, Prof.
Yeah. Of course, this is a clinical case, which I believe medical doctors are more aware of it. But maybe I'm talking as a patient, you know. I'm taking the patient, my own experience, and then my feelings and so on. So the scenario is very well done. And it is very common, and I maybe get a chance to advise medical doctors dealing with the patient is really high wisdom. Yeah. So beside the waiting time, and not only this, but even when you are talking with the patient, sometimes a medical doctor, especially the young one, not have a good etiquette. So they start to ask the patient things which is not to be mentioned there. Yeah. So I remember one of my friends telling me that he was going to surgery, and when he sleeping, lying down there, then the doctor has to ask him from which country you are and how long you are here. So he said, "No, I am going to die." So what I want to say here is doctor is a cross-border person, has no nationality, I believe. And I usually say that doctor are malaika. This is earlier of one of our scholars, I think Raghib al-Asfahani, describing that the malaika do job and their job is for God. And I believe also the doctors doing the job of God. That is assist somebody to survive, not to die, to extend his life. And this is really, it is great job. So you should not put yourself in very, what you call simple issues like nationality, like how much salary you are getting. And these issues are not your issue. You are more bigger. You see the human as human, regardless of culture, ethnicity, religion, human. You save the life of the human. And this is Malaika job. Thank you very much. I believe the group well done. And this scenario, I believe maybe this is need to take seriously to be trained the young doctors to learn the etiquette, how to deal with the patient in the clinical cases. Thank you very much.
Okay, thank you very much, Prof. Ibrahim, for such an insight. I think that is from the patient points of view. So we already have from clinician point of view, from Prof. Amin, and then Prof. Ibrahim as a patient point of view. So I think, yeah, this is something that we as a clinician should take note on. And then it is something that is, it won't come naturally most of the time. So we need to learn and then to be trained on how to do it. Thank you very much, Brother Dr. Akil. Thank you very much, Prof. Amin, and thank you very much, Prof. Ibrahim, for your comments. So without further ado, I would like to invite next group. Maybe we can go back to group 9 if you are ready. If not, we shall proceed. Dr. Zulaikha, is it? Your group 9.
Yes, yes, Dr. Khairul Anwar from
Okay, you may proceed with your presentation.
Okay, sure. Okay. Okay, Assalamualaikum and a very good morning to our respected panels and colleagues. Sorry for the some technical issue just now. So I'm Dr. Siti Zulaika binti Zulkifli, a representative from Group 9. This is my list of team members, and our group was supervised by Assistant Professor Dr. Muhammad Faiz bin Tahir. So this is the case scenario given to our group. The case scenario given is you realize that it is always difficult to refer a case from one department to another, or even the district to the tertiary center. Some doctors at the hospital look down on the doctors from the community or health clinic, and some will feel that their department is always right in comparison to the other department. In your opinion, how to improve this referral culture to be more harmonious without any miscommunication? So this is some issues identified during our group discussion. Among of them are hospital culture that may not prioritize the teamwork and mutual respect. There are lack of collaborative effort and knowledge sharing between the different medical specialties. There are also insufficient training on the importance of referrals and interdepartmental collaboration during the medical education. There are also inadequate or ineffective communication channel between department and healthcare facility. There are also some attitude of superiority and inferiority between the doctors from the different setting, leading to the reluctance in taking the referrals. The complex and time consuming for the referral process, leading to the delay and dissatisfaction. So basically, how to handle this situation based on the Islamic ethic and the professionalism. So by definition, Islamic ethics define value as a good character shaped by the Al-Quran teaching and Prophet Muhammad Sunnah, as well as numerous precedents set by the Islamic jurists. Thus, Islam presents a complete code for living that is framed by the ethical value, Ibrahimi 2017. And professional ethics, which concern one conduct of behavior and practice when carrying out professional works, need itqan. The word itqan is an Arabic word which has a close meaning to the English word perfection. Islam is a perfect and comprehensive religion, set the basis for the quality work. The order, discipline, accuracy, beautiful work, well thought of task and justice are part of quality Islamic work and performance according to the Shuri 2009. So according to the professional manner, this issue should be tackled by every healthcare provider should having a faith that we are merely the agent, not the healer. Thus, we will be more humble and less boastful. Always be in the best character, yeah. Ahsan al-akhlaq, balance, tawazun, humility, tawaddu, brotherhood, ukhuwah, social respectability, and promote the finest human communication. Thus, we also need keeping in mind that this commitment is a responsibility that needs sincerity of intent, work quality, and societal responsibility. Always have intention of willing to help, answer by using his or her expertise to assist others. And second, we should take a Prophet Muhammad SAW as a role model, not only upright but devout and caring, modest on action and leadership, enticing, lead to the other, including courage to virtue and righteousness, avoiding harm, promoting a good role model. So this is our suggested quick action of plan to harmonize the referral system in the healthcare system. So first, for the hospital culture, we should conduct a culture assessment and workshops to promote the teamwork and respect, reward the exemplary behavior, and encourage open communication. This is consistent with the hadith narrated by An-Nu'man bin Bashir. Allah Messenger said, you see the believers as regard they are being merciful among themselves, showing love among themselves, and being kind. Resembling one body, so any part of the body is not well, then the whole body share the sleeplessness, and fever with it. Sahih al-Bukhari. So second is a good training and education. We should provide a training and educational opportunity for healthcare staff on the importance of the referrals and effective communication. Ensure that all team members are knowledgeable about the referral process and understand their roles and responsibility. Third, a good collaborative effort and knowledge sharing. Establish the interdisciplinary forums and joint training session and utilize the digital platform for the information exchange become easier. And fourth is the referrals and interdepartmental collaborating training. Revise the medical education to emphasize the importance of the referrals and collaboration, and also facilitate the interaction between the different specialties. We should address the attitude of superiority and inferiority, conduct a diversity training and foster appreciation for all specialties, create the opportunities for the collaboration. This is consistent with the hadith narrated by Anas bin Malik that the Prophet ﷺ observed, none amongst you believe until he loved for his brother, or he said for his neighbor that which he loved for himself. Hadith Muslim. And provide a feedback mechanism. Establish a feedback mechanism to gather input from the healthcare provider and patient about the referral process, and take this feedback can help to identify the areas for the improvement and address any challenges or issue. And then we need to improve the communication channel. Perhaps you might appoint a licensed officers for interdepartmental communication. And last but not least is to streamline the referral process. We should implement a standardized referral protocols and guidelines to streamline the process, review and simplify the referral procedure, implement a digital referral system for efficiency, prioritize teamwork, communication and education to create a more efficient healthcare system. This is tally with the hadith narrated by Anas bin Malik. The Prophet Muhammad SAW said, make things easy for the people and do not make it difficult for them, and make them calm and do not repulse them. So this is the references, but this is our references. And basically the take home message is everybody in the healthcare provider should apply the professionalism and also Fiqh Muamalah if possible, so that the system will become more harmony and easier for us. That's all from me. The floor is back to you, Dr. Khairul Anwar.
Thank you very much, Dr. Zulaikha. So I think this is one issue that something that is I think quite important to be addressed. So I think without further ado, I would like to invite maybe Prof. Amin again to comment on this issue.
Okay, Alhamdulillah. Jazakallah khairan. It's very good issues. I think this scenario actually is the real scenario that is a problem in the hospital setting. Clinical, interdepartmental, and then poor teams, communication. That's the reason why certain modern hospital now, they come to the conclusion that they need interdepartmental team rather than separate team that what we have now. Sorry, big noise. I don't know where they come from. Okay, this actually is an important issue that you are highlighting, and then I feel glad that see that you come with some suggestion and resolution how we should go about it, which is I think that is a good suggestion that we can improve in terms of hospital, especially for our own hospital, which is a Sharia compliant hospital. And then this is always the problem, and is in terms of the training or education. We don't really highlight the in fact how to do a referral or how to write a referral during the medical student time. But I think in the postgraduate level, we should come in terms of the proper way how to do a referral, and then at least during the postgraduate training, the earlier part, how to deal with your colleagues in the other department as well, which is I think I need to address something which is for example, how important the interdepartmental team work. I actually is coordinating the diabetic food team for the hospital, which is include orthopedics, endocrinologists, vasculars, plastics, nurses, everything. The referral going to be easy because wherever we see the patient, and then straight away that we refer to this one, and then no need for us to call them to come and whatsoever. They straight away we can see they are actually doing it together rather than this one. And then the combined round or combined team will have the good communication, especially those who are expert in a certain field. They give their advice as well, and then others can take it as a learning process or something like new things that they learn. Then I think it's they develop something like a good environment for the clinical work. The problem now is, sometimes the consultant, the specialists, don't really do the proper round, and then they come across something like suddenly they have a thing that we cannot solve with the problem, and then they start, pushing patients everywhere. So this is a problem in the clinical setting, which is I think need to be addressed as well. And then the communication, the one that you mentioned about the problem just now, is most of them actually is related with the communication. Doctors now, they cannot communicate well, and then this is actually a skills that need to develop to all the doctors so they can talk to each other. And kadang-kadang kalau MO refer kat specialist tak nak terima because why? Oh, it's not my level. So there is things that actually is something like what we call there is no humbleness, the element of arrogance. There is a poor or lack attitude of the helping people, which is actually growing in our committee, actually, in the paternity, the medical paternity, which is I think need to be addressed properly. Thank you. That's my comment. Thank you.
Thank you very much, Prof. Amin. Maybe I would like to invite Ustaz Abdul Rahman, maybe to give his comments on this topic. Please, Ustaz.
Thank you, Doctor, for inviting me. Just a short comment. I think one of the important things training presented by a presenter, training how to train. But training is also the formal. So we need the others. My suggestion to do a program interdepartmental program. This is non-formal. Mungkin mengopi, futsal and so on. Because when we do the informal activity, we can create the bonding more than the formal activity. So I think this is very important because we have always have the formal activity. We have seminar, we have conference, but non-formal activity between interdepartmental is very, I think it's not so many. So we can do it maybe this month, orthopedics and medical and surgical. After that, we can see the difference. This what I can see. And the second one is we need to create the spirit of ta'awun. Ta'awun in the mindset. Ta'awun with helping each other. Because ta'awun, I think, helping each other is not for Muslim only. Even for the non-Muslim belief, all the religion have the same belief on this. We need to help each other. So this the very important value ethics that we need to instill on all in all of doctors, especially to overcome the miscommunication problem.
Okay, thank you very much, Ustaz Abdul Rahman and Prof. Amin for your comment. I couldn't agree more with that. Thank you very much, Dr. Zulaikha. So the most important thing I think will be understanding of communication between each department, and then I couldn't agree more on that. So I think without further ado, I would like to invite next group, Group 11, to present their topics. Please welcome Group 11. So welcome Dr. Wong, is it?
Yeah.
Okay, the first is yours, Dr. So you have 10 minutes. Yeah. Once you start, we'll start the count, the time.
Good morning to Datuk, Professor, Associate Professor, and fellow postgrad colleagues. My name is Wong from Group 11. My task given, the task given to us is to describe termination of pregnancy in Malaysia, supervised by Assistant Professor Dr. Ashikin. So today I will discuss on the situation and regulation of termination of pregnancy in Malaysia, and subsequent topics, the indications, complications of termination of pregnancy will be presented by my colleague, Zawani. First of all, abortion here means the expulsion or removal of embryo or fetus from the uterus in the early pregnancy of less than 22 weeks or 500 grams by weight. And the termination of pregnancy is confined to the procedure to remove the embryo or fetus early in pregnancy. Induced pregnancy is associated with socio-economic problems and the improper family planning. Unsafe abortion might end up with serious complications such as septicemia, which is preventable. In Malaysia, unsafe pregnancy is one of the causes for adverse maternal outcome. Termination of pregnancy is illegal in Malaysia unless there's specific medical reason identified by registered medical practitioner. The provisions is stated in Penal Code Act 574, Section 312. For the Islamic perspective, the fatwa agrees termination of pregnancy, which is subjected to certain conditions. Generally, termination of pregnancy is discussed if continuing pregnancy is a threat to women's life or their physical mental health. In Malaysia, maternal death attributed to abortion was low in incidence. The data here probably is quite old, more than 20 years ago. When you look at 2000, only 2 cases caused by abortion due to septicemia and shock, 1 case respectively. To improve maternal health with respect to termination of pregnancy, KKM has developed a guideline in 2012 to promote awareness of this complex issue, which incorporated various aspects, including professional ethics, legislation, religion, and reproductive rights. As clearly stated in Malaysia Penal Code, induced abortion is illegal, but with an exception clause. Reading as so, if such medical practitioner is of the opinion, formed in good faith, that the continuance of the pregnancy would involve risk to the life of the pregnant woman or injury to the mental or physical health of the pregnant woman greater than if the pregnancy were terminated. So the termination of pregnancy should get the pregnant woman, her family, and attending doctors involved to discuss on the indications based on the existing comorbidities, particularly to the cardiac disease and the risk of continuing the current pregnancy. Within the discussion should also include counseling session and address the complications, legal and religion concerns. That's all from me. Subsequent presentation will be continued by my colleague Zawani. Thank you.
Share my screen first. All right, okay. Can you see my slide?
Yes, yes, Zawani.
So I'm going to the indication of termination of pregnancy. The first one is for the maternal cause and the second one for the fetal cause. For the maternal cause,
Basically, if there is a life-threatening medical condition that the mother has, such as a high-risk patient with maternal cardiac disease, but not all cardiac disease is indicated for termination of pregnancy. Only in the patient who in the high risk group are advised for termination of pregnancy, such as severe mitral stenosis, severe pulmonary hypertension, and Islamization syndrome, and so on. So why is that so? Based on the previous data, said that since 2009 until last year, 2022, the rate of maternal deaths due to the cardiac disease is basically remains static, about 10 to 15%, despite the advancing in our provided here. So based on this, we can see that if the patient or the mothers have fall under classified of WHO class 4, in which they are associated with about 25 to 50% risk of death when they are continue their pregnancy. So this is based on the WHO classification of maternal heart disease that are allowable for pregnancy, and the one that is contraindicated, such as in the group 4, in the group 4 with maternal mortality is about 25 to 50%, as I explained before. So next indication of termination of pregnancy is current severe psychiatric disorders, when there is mental health condition that can lead to life-threatening condition, such as suicidal ideation, infanticide, everything, provided that the psychiatrist has already optimized the medication with a good family support, but then the patient or the mother still cannot continue the pregnancy because of the risk of harm. So that's why there's indication for the termination of pregnancy for the maternal cause. Next, we move on for the indication of TOPA for the fetal cause. Because of the first one is little congenital anomalies, such as anencephaly, there's no brain or the skull of the babies, and then or other little congenital anomalies, genetic reason for the trisomy 13, Patau syndrome, and Edwards syndrome. But for the Down syndrome, there is not indication for termination of pregnancy currently, because lifespan of the Down syndrome and with the variation of the presentation, usually Down syndrome is not indication for the TOP. And then another thing is hydrocephalus. Not all hydrocephalus are indicated for TOP, only the one with little congenital anomalies, because hydrocephalus in some of the babies are reversible when the cause is treated, such as with advancement of intrauterine transfusion, and also treated for the infection. So the indication of these are basically needed expertise from the consultant or senior obstetrician to know that if there is if the fetal is can be continue with the pregnancy, if the mother can continue with the pregnancy or not. So basically, to have a safe abortion or safe termination of pregnancy, Malaysia and also RCOG have provided the latest guideline, either from the medically using a pharmacological option, or surgical termination of pregnancy using aspiration or suction and curettage. Moving on to the complication of TOP, generally it's a safe procedure if it's done and with a certified obstetrician, but if it's done illegally via a private practitioner, GP, or even over-the-counter medication, it can cause harm to the patient. What are the complications that may occur? The first one is severe bleeding, cervical trauma, uterine perforation, ideally during the surgical evacuation of the fetus, uterine rupture in the case of with previous history of cesarean section, septic abortion if it's done using a septic technique and psychological security of the mother, especially if the mother is basically keen to continue the pregnancy, but then because of her current medical health, the pregnancy is not is not allowable lah. So moving on to the keputusan Muzakarah Jawatan Kuasa Fatwa Majlis Kebangsaan Malaysia based on the year of 2010. The first surah has been stated during the Muzakarah. The first one is basically surah based on Surah Al-Mu'minun verses 12 to 14. We created man out of the extract of clay, then we made him into the drop of life germ, and we placed it in a safe depository. And then we made this drop into a cloud, then we made the cloud into a lump, then we made the lump into bones. Then we closed the bone with flesh. Then we cause it to grow into another creation. Thus, most blessed is Allah, the best of all that created. Based on this surah, basically we know the process of embryogenesis is very specific and it's already been described years back before the advancing of the science. So next, moving on to the when exactly the ensoulment occur. Is it 120 days or is it 42 days? These different school of thought based on basically because of these two hadiths. The first one, why 122 days, by the hadith narrated by Al-Bukhari Muslim, said that the creation of each one of you is collected in the womb of his mother in 40 days. And then something that clings, alaqah, then he becomes for 40 days. Then he become mudawah, a chulam for another 40 days. So from here is total 120 days. The angel then sent to him, and the angel writes 4 things: his provision, his lifespan, his sleep, and whether he will be rash or blessed. Then the spirit is breathed into him. The second verses hadith is basically narrated by Muslim. When the nutfah enters the womb and stay there for 42 nights, God sent an angel to give it form and created it hearing, sight, skin, bones, and flesh. So these two hadiths basically is not contradicting each other, but both of them are complementary each other. So why I said like that? The first hadith of 42 days refers to development and functioning of their brainstem. 42 days, ideally in a new world, is equal to 7 to 8 weeks of gestation. And as we know, organogenesis or basic human formation is already completed, almost completed by the 8 weeks of pregnancy. The brainstem is already formed, but there's no synapses. There's no connection between the brain and all the limbs or the heart. As because of this, and we can see organogenesis is already formed. We can see from the ultrasound even there's a fetal echo of fetal heart present during the examination. But for the hadith of 120 days, it speaks about the higher center and their control over the lower ones, meaning that at these days, usually the quickening is already felt, meaning that baby has already control over their body, over their upper and lower limbs. So from the conception, basically conception occurred 2 weeks after the last menstrual period in this ovulation day. Based on that, current population nowadays, 2 weeks because of the ovulation plus 120 days is about 134 days from the last menstrual period. Is equal to nowadays called based on the last menstrual period is a 19 weeks 1 day of gestation. So from that, moving on.
Dr. Zawani, can you wrap it up because we're running out of time?
Okay.
Yeah. Okay. Another 1 minute. Okay.
Okay. Sorry for basically continue with married couple. So it's a macro to abort fetus less than 8 weeks if there is no harm towards the mother. But then in general, it is harus if is the fetal there is a malformation of the fetus or become a life-threatening to the mother. However, more than 120 days is haram because abortion is especially if intentional, but if it's still allowable if is for the sake of the mother. For the rape victim, is haram if the fetus is more than 19 weeks gestation, but then is cause is haram if it's less than 19 weeks. But if there is fetal malformation and has illness and threat to the mother's life. In general, adultery or fornication is still haram to abort the fetus because unless the fetus or the pregnancy will cause harm to the mother. And for the patient with person with disability, provided the IQ is less than 80, is basically haram to perform if the fetus is less than 19 weeks, but it's haram if more than 19 weeks unless it threatens the mother's life. I think all of this is basically based the ruling because of the protection of the life as we explained before. I think that's all. Thank you.
Thank you very much, Dr. Zawani, for such an interesting presentation. So I would like to invite Dr. Usman maybe to comment on the topics.
Assalamu alaikum wa rahmatullah.
Alaikum assalam wa rahmatullah.
Well, the doctor has covered the topic extremely well and very comprehensively. I think what is just some suggestion I would like to add is some of the underlying factors, maybe the spiritual factors that are involved in this when dealing with these sort of cases that the medical personnel needs to bring into this, because this is very, if it is like this, then it is like that. If it is like this, then it is like that. However, there is an education component that needs to be brought in, especially for your patients and maybe for the medical personnel themselves. Life and death is all in the hands of Allah subhanahu wa ta'ala. For instance, the Tawheedic paradigm, for instance, like where this is going, why the fetus is deformed, for instance, maybe. These are all things that needs to be addressed as well when dealing with these type of pregnancies, when they can and when they cannot be terminated. Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Usman. Maybe I would like to invite another Datuk Hamidun, if you are okay to respond.
I'll just say congratulations. The group has covered comprehensively, alhamdulillah. In terms of the hukum, the fatwa is already there. Thank you.
Okay, thank you very much, Datuk, for such a nice comment. Thank you very much, Dr. Wong. Thank you very much, Dr. Zawani. Thank you very much, Dr. Usman and Dr. Hamidun. So I think now we can proceed to the next group. I would like to invite the group 12 to present their presentation.
Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum.
Can you see my slide? Okay.
Yes, Dr. Munirah.
Okay, I'm a proceed. Assalamualaikum warahmatullahi wabarakatuh. I'm Munirah from group representing about from group 12 with group member Dr. Liana, Dr. Nur Saufia, Dr. Dasha, Dr. Kwan, and then me myself. So we are giving our group was given a case scenario where an 18 years woman, primary gravida at booking at 12-week period of gestation. She is very marital conception. She requests for termination of pregnancy as she felt stress of her pregnancy. Okay, definition of TOP was presented by previous group. Is confined to procedure to remove an embryo of fetus where the pregnancy is less than 22 weeks of gestation. If patient or woman unsure of gestation, fetus is estimated to be less than 500 grams. In Malaysia, there is clause about safe abortion service is legal if pregnancy is a threat to a woman's life or when the pregnancy poses a threat to a woman's physical or mental health based on Penal Code Act 574, Section 312. Because the woman request for TOP because she is stressed, there is a role to seek opinion from psychologist or psychiatric to assess the extent of degree of stress, whether it's succumb into the severe depression or severe suicidal risk. Full assessment examination need to be done to determine any coexisting health issue, and this should include a general mental health assessment. For the patient, medical abortion counseling must be done. So Muzakarah and Fatwa Bilangan 19, prenatal conception, elective abortion of viable fetus in a healthy mother is prohibited. Abortion is permitted if continuation of pregnancy may cause the pregnant woman to die or cause serious deterioration of health, both medical and mental, if done before 120 days after fertilization is harus. So for these ladies, must be have assessment from PSY first lah to assess the degree of stress, to assess the root of stress, and then stress is stabilized with medication or tackle the root of stress. Okay, when it comes to the issue in the medical practice, the benefit of each decision must be on strong foundation, reason, and evidence. The Sharia dominates all over others' rule and or disagreement based on Fiqh Muamalah in medicine. Masalah benefit versus harm. Avoiding harm is more important than obtaining good. Maqasid Sharia, the meaning and wisdom considered by the lawgiver in all or most circumstances of Sharia. Such consideration is not only confined to a specific type of Sharia ruling. When and do not kill anyone which Allah has provided except for a just cause, and whoever is killed intentionally with hostility and oppression and not by mistake, we have given his hair to authority to demand qisas, law of equality in punishment, or to forgive or to take diyah, based on Al-Isra ayat 33. Okay, case scenario 2. A 40-year-old woman recently divorced 1 week ago, noted to have missed period. Turned out her UPT was positive and she requested for termination of pregnancy. Okay, talaq issues to a pregnant woman is valid in Islam, but it's the lawful thing which Allah hates most. According ayat in Surah Talaq, ayat 65, and for those who are pregnant, whether they are divorced or their husband are dead, their iddah is till until they lay down their burden. Safe abortion service is legal if the pregnancy is a threat to the woman's life, or when the pregnancy poses a threat to the woman's physical and mental health. One of the essential maqasid is protection of life, and do not kill anyone which Allah has forbidden except for a just cause, and whoever is killed intentionally or with hostility and oppression and not by mistake, we have given his hair to the authority to demand qisas, law of equality in punishment, or to forgive or to take diyah. I think that's all for presentation from our group.
Okay, thank you very much, Dr. Munirah. Maybe I think this is actually another interesting topic. I would like to invite Ustaz Abdul Rahman if you would like to comment on the issue.
I think this will cover all the important things. But just I want to share about the principle for this group and the previous group. Why we see the fatwa, treatment for mother life is more prioritized rather than condition of the baby. If you see the fatwa, why the treatment for mother life we need to be prioritized than condition of the baby? Because both of them have the save the life. Because mother is already lost, but the baby we not sure he can survive or not. So when in this condition, we need to prioritize who is confirmed first. The principle. That's why the fatwa said we can terminate the abortion, the baby, and so on. But if return the mother life, we can do it. Whatever condition, especially when after 4 months and after 4 months, so it's more strict. But this also have the debate between scholar, but we have the fatwa, the official fatwa. So I think we already discussed, we can follow it straight away. But in the scholar between Hanafiya and Mazhab Malikiyah is have a debate about this problem or this condition.
Okay, thank you very much, Abdul Rahman. Maybe I would like to invite Prof. Ibrahim. If you have any comment on this topic.
Yeah, thank you very much. I think we have some to say here. Abortion is sharing area between biology, medicine, and religion as well. Besides, also abortion addressed to maqasid maintaining the life and also progeny. That is why it is very rich and very important to be discussed. Besides, actually, maqasid also, the abortion or termination of the pregnancy also address legal dimension and also Sharia dimension. So if you are Muslim and living in USA, some state allow abortion, but your religion may not allow. So I believe it is very good topic and very rich. Two group already presented, and the topic is really deserved to be done. And the scenarios given also giving very rich idea. But maybe one observation I can give about the maybe presentation altogether. is about the researchers try to identify the scenario under which he went, for example. Right now, they given two scenarios. One of them is 18-year girl. Okay, the second is 40 years. So the person who designed this scenario is trying to give different cases. So you need to identify the case, and then you can go to the legal perspective and maybe Sharia perspective. Sharia perspective, you mentioned two hukum, that is haram dan harus, for example. That means permissible or not permissible. But there is others also sometimes. Actually, termination could get wajib also. It is from Sharia perspective, it is wajib be terminated because really endanger the life of the mother, for example. So what I mean is then the researchers try to find. In medicine, usually you cannot give medication until you diagnose it. So you know what type of disease is. Here also you cannot give hukum, that is a decision, making medical decision without knowing what is the case. So I hope all cases actually, because these are the scenario-based research. So the focus here, I believe the researchers should focus on what case is it actually. Long research should be done there. So I think well done, cases are well done, and it is, as our colleague mentioned, it is very comprehensive and try to so. But we still need to see what case is it. What case is it? I hope that should be my perspective. Thank you very much.
Okay, thank you very much, Prof. Ibrahim, for such an insight. Thank you again to Dr. Rahman and also Dr. Munira for your presentation. So I couldn't agree more. So it should be a case-to-case basis. So we shouldn't generalize things, and then we need to tailor the decision case by case. So I think next I would like to invite the next group, which is team group 13, to present the presentation. Please, the floor is yours. Dr. Fakhrazi, you are group 13, is it? Or group 12?
Yes, yes.
Okay, the floor is yours.
Can you see my slides?
Not yet. Did you share the content? Okay, now yes, we can see your slide. Please proceed. The floor is yours.
Sorry. Is my slide still there?
No, I think you just closed your slide just now. Okay, now it's on again. Okay, you may proceed.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Fakhrazi bin Amazubi, and I'll be presenting the topic of Islamic principles in medical practice, representing Group 13. So my group members are Dr. Shahin binti Muhammad Ruslu from anesthesiology, Dr. Siti Aisyah binti Yahya from family medicine, Dr. Jovan Fulok from radiology, Dr. Nur Atika Izzah from internal medicine, and Dr. Rikani Murti from ONG. So we are given a task comprising two questions. First, please describe the indication of medical leave. Second, a comment and answer based on the case scenario. A 40 years old man
requests medical leave for his cough, but upon your assessment, you noted that he's completely well. How will you respond? A second question, a second scenario, a 28 years old woman requests medical leave for taking care of her 7-year-old children who are currently having day 1 fever due to tonsillitis. Would you give? How will you respond? So the task number 1, please describe the indication of medical leave. Before we explain about the indication, I would like to define the term medical leave or medical certificate. It is a legal document or certificate that can only be issued by a registered medical practitioner for the purpose of certifying that a person suffers from illness sufficiently severe enough to be excused from their work or duties. It should only be issued after the registered medical practitioner has performed an appropriate consultation with the patient, including history taking, physical examinations, and investigation where necessary. So if you find anyone selling medical certificate in Shopee, Lazada, eBay, Alibaba, or any online platform, it is definitely illegal and they can be charged for it. Malaysia Medical Act 1971, a fully registered medical practitioner is a person recognized by law as a member of the medical profession. No certificate or other document required by any written law to be signed by a duly qualified medical practitioner given after the commencement of this act shall be valid unless signed by a fully registered medical practitioner. So we go to the indication. A person is entitled to use medical sick leave when he or she receives medical examination and treatment and is incapacitated for the performance of duties by physical or mental illness, injury, pregnancy, or childbirth. If the registered medical practitioner in their professional judgment feels the illness is so trivial as not to interfere with the patient's work, they may choose not to give a medical sick leave. If it is up to the medical practitioner to decide based on his ethical, moral, Islamic professional judgment whether or not the MC is really needed. However, an attendance note may be given to certify attendance at the clinic or hospital. It may be good practice to ask a patient before concluding the consultation if they require medical sick leave to avoid letter requests and accompanying issues. We all have been to hospitals and we know the hassles of being inpatient in the health facility. This may consume a lot of time, and your patient will need a proof of attendance to be given to their superior. For case scenario, 40-year-old man requests medical leave for his cough, but upon your assessment, you noted that he is completely well. How would you respond? As a healthcare professional, a good communication skills is as vital as clinical skills. It is one of the most important factors to be considered, and I would approach the situation with empathy and understanding. 70 to 90% of the time, the diagnosis will be gathered from history taking. We will partially understand what went wrong to our patient from the history, and physical examination will help our direction of working diagnosis. I will reassure him on my clinical finding and inform him that his condition did not warrant him for taking medical leave. However, if his symptoms worsen or develop any new concern, I suggest him to come again for reassessment. We may not know what happened to him or her before they come to see us, and we are not sure what will happen in the future after he leaves our room. So we can suggest and advise to the patient to come again for reassessment if necessary. Next scenario is the 28-year-old woman requests medical leave for taking care of her 7-year-old children who are currently having day 1 fever due to tonsillitis. Would you give, and how would you respond? For this case, I will explain to the mother appropriately that I will not warrant her request. Medical certificate is strictly for patient, not to accompanying person. However, they are eligible for time off sleep during the hospital visit. As a healthcare professional, my primary goal is to ensure the well-being of both the children and parent, while at the same time maintain a mutual respect, being fair and objective in my evaluation. So the discussion part, Islamic ethical principle. In Islamic perspective, medical certificate serves as documentation issued by medical professional to attest to a person's medical condition or fitness for specific purposes, such as employment, travel, or participation in certain activities. These certificates should be handled with integrity, honesty, and adherence to Islamic ethical principles. It shall be issued in accordance to protect or preservation of the higher intents of Maqasid Sharia, religion, to protect life, progeny, mind, and wealth. Truthfulness and honesty, providing false information or exaggerating medical condition on the medical certificate is considered dishonest and goes against Islamic principles. Islam emphasized the importance of truthfulness, and intentionally misrepresenting one's health status is not permissible. First, we do no harm, non-maleficent. We attended our patient accordingly. We document with honesty, and we become a professional Muslim that bring Islam up to the highest level where it belongs. We protect the religion, not to create a chance or bring slander to our deen. Sincerity and intention. Medical professionals should issue medical certificates with sincere intention to help the patient. Should not issue a certificate solely for personal gain or any unethical purposes. You should not make it profitable, make it online, or give it to the wrong person. We should focus on helping people in accordance to Maqasid Sharia. We need to protect the life. Patients need to be exempted from their normal activity in order to rest and recover from the illness, not to allow the worsening symptoms affecting his life. Empathy and compassion. Medical professionals should approach their patient with empathy and compassion, as these qualities are highly valued in Islam. Understanding a patient's health condition and providing appropriate care are essential aspects of the medical profession. If we do our own part professionally, we are doing favor to the mankind. Just imagine, by being empathy and compassion to this job, we already reduce the burden of his or her miserability. According to Maqasid Sharia, we need to protect or preserve the mind and intellectuality. Non-healthy person will eventually affect his mental health. Hence, preservation of the mind is important in this situation. By that, I end my slide presentation. Thank you.
Okay, thank you very much, Dr. Fakhur Razi. Maybe I would like to invite Prof. Amin to share his comment on the topic. Please, Prof.
Yeah, Bismillahirrahmanirrahim. Thank you, Fakhur Razi, for your good talks in terms of the medical leave. For your information, this medical leave is a right of doctors to prescribe. Okay, and then this is not a right of a patient, but patient's warrant of the medical leave. For your information, there is a latest news in the Employments Act 2020. There is the term medical leave is divided to the hospital leave and then sick leave. And then most probably it depends how we interpret the law letter. Maybe when the patient admitted, we have to give a patient a hospital leave, and then as usual, patient came to the clinic or follow up, or patient need the leave, we give them the sick leave. There is the new term actually is going to be introduced later or sooner. Okay, for the I think you are covering well what is supposed to be done in terms of doctors, because this is a part of our responsibility. Is we need to be judgmental. Our clinical judgment is important to decide whether patient really need the leave or not. For example, sometimes when patient actually is the first time they came, and then they presented with the problem, and then whether patient can carry the most important thing that we should ask what is the patient task or nature of works that patient do, because sometimes there is a depend on the task that they have. For example, there is a patient having the hypertension, which is have stress, everything. Although the symptom is not that much, but is the stress that patient have during the task actually is also warrant patient to get the medical leave, or the patient to have recover by themselves, or they can take their own leave. If you can decide. It depends how they deal with the doctors, how we assess them at that particular time. The problem is with the patient with we need a long leave, like patient having fracture, patient have get the chronic disease, everything. This is also need to be taken care properly, because we cannot just continue the MC. This is something which is a need judgment at that particular time. Then how long we should give the patient is according to the how long they are necessary for patient to away from their own task, own job. Okay, for example, is when you have a fracture. Okay, or like orthopedic patient, you have a fracture. Okay, there is a difference when patient is the engineer who have to go to the offshore compared to those who are actually working in the office. Much different. You can't really say judge that the time, the period that you give the medical leave and for them actually is going to be different. It's not similar. That is come to the decision, the clinical judgment of a doctors, how they have to do that. Because whatever doctor give the prescription, everything, that is considered legal for the patient. That is my comment about that. I think this is something which is a very gray area that we also have to really take care with the good professional as well as ethical. And then when we talk to the patient, when we are rejecting the patient request for MC, we have to really talk to the patient properly in the proper manners, and then make sure that they don't really feel will feel bad about our rejection of the MC, because there is a common thing that happens. Sometimes patients don't have any problem, they just come to get the MC with you. This is not only in the
Sure, I think maybe Prof Amin's connection is been cut short. So maybe
Prof Ibrahim. Very short.
Yeah, please. Patient points of view.
Yeah, thank you. I think Dr. Amin or Prof Amin make it very good. But I want to say here, medical leave is amana, testing both the ethics of the patient and also based of the ethics of the doctor. Therefore, from Islamic perspective, I think the person should be responsible as a patient. Don't request this until you feel really need it. That is ethically. Also, the medical doctor should not just give until he have some basis. But the case which maybe the presenter mentioned about the what you call flu case, the person come and claim that he has flu, but you check as a medical doctor, then so I believe also as a medical doctor, you should have a wisdom that you should not just say that no, I cannot give, just go, because this may create also some kind of misunderstanding and mistrust between the doctor and the patient. And the relationship between the patient and doctor is just like between the child and the father, or the child and the parent. So sometimes your child is lying, but you should trust him. Give trust. Just like lecturer, your student telling lie, but you should give some trust to test his, to change the behavior itself. Therefore, if I am the doctor and then the patient claims that he is not feeling well, but I realize that he is just telling me some other reasons have. What I do, maybe I give but very short time. 1 hari saja. For example, I go to other reasons. That means I trust you. I give trust. I give trust. This is maybe just something which is extra I give. Therefore, I believe you are really in very critical situation as a medical doctor. But you need to be honest to your profession and at the same time to Allah subhanahu wa ta'ala. One case which I want just to indicate here is sometimes actually the medical doctor himself should suggest, and I'm sure you are practicing this, suggest to the leave. If, as Prof mentioned, there is two kind of leave now here. Okay, hospital and medical. Very nice. So I think we need to be careful. One more thing, I'm sorry it took long time. The case of child care. So that is also indicating to identify the case is very important because that case is not medical case anymore. To identify, to diagnose the case, is it really medical or it is social? So that is social reason to care your child is our boss or his boss should take decision on that, not the medical doctor. So what I mean is these kind of things are very important. Thank you very much.
Okay, thank you very much, Prof. Ibrahim. Thank you very much, Prof. Amin, for your comment, and thank you very much, Dr. Fakhrazi, for your presentation. So I would like to invite the next group. I believe it's group 13 or group 14.
Group 14.
14. Yeah, Dr. Husni. Okay, Dr. Husni, whenever you're ready, the floor is yours.
Sorry, I'm just share my slides. All right, can you all see my slides?
Yes.
Yes, all right. So I think I should start now. So Assalamualaikum and a very good morning to all. My name is Muhammad Husni from the ORL department. I'm representing group 14 for our presentation this morning. So this is the list of our group members: Dr. Amirah from Family Medicine, Dr. Khairul Arif Family Medicine, Dr. Naswa from Anesthesiology, Dr. Fatima from Surgery, myself from ORL and HNS, and Dr. Irfan from ONG. And we were supervised by Dr. Taufiq Hidayat Hassan, which is our pediatrician. So today we were given two questions. So the first one was actually one of your medical staff refused COVID-19 vaccination. So the question was, what should be your response? And question number two, your staff nurse referred to you a case of missed immunization of 11-month-old boy, which was missed since 9 months old. Parents refused because they opted for natural immunity. How would you respond and advise the parents? So I think I'll be discussing these two in a similar scope, because this is basically an issue of vaccine hesitancy. So this was actually a very heated and controversial topic, especially during COVID-19 pandemic. So I think we'll be talking about this specifically. I'll be talking about some of the factors and also how we approach them from the Maqasid Sharia and the principles of medical ethics. So first of all, I think if you know that people don't want vaccines because of several reasons. There are misconceptions, they hear fake news in social media, they hear the conspiracy theories. There are some people who are using some religious objection as well, saying that it's impure, haram, etc. And then there's a pressure from a significant other. For instance, one parent wants it, but the other parent doesn't want it, or because the general family members or the group that they, or the community or the group that they are from, pressure them not to take vaccines. And then there are also some people who are determined to take the alternative action or alternative route. For instance, during the COVID-19 pandemic, people tend to opt for ivermectin, for instance, another medication, instead of going for the COVID-19 vaccination. So there are multiple factors, which we're not going to talk about much, because we're going to focus on two things. First is the Maqasid Sharia, which are the objectives of Sharia, specifically discussing about the maslahah and the mafsada of vaccination. Next, I'll be talking about the ethics and professionalism, especially principles of medical ethics and how we communicate and how are we to become more competent in actually advising patients to take up vaccination. All right, so Maqasid Sharia, as we've read or we've listened to yesterday, is basically the goal or the objective of our religious legislation. And basically the meaning, purpose, the wisdom of our Sharia is basically to ensure our own benefit, welfare, maslahah. Because Allah subhanahu wa ta'ala knows exactly what we need as human beings. So they know that the Sharia, the path, is actually for our own benefit. And the purpose is basically to protect. So some books say 5, but there are scholars who put the 6th one as well. So first is protect the religion or deen. Second, to protect their life or haya. Thirdly, to protect the progeny or nasab. Fourthly, to protect the mind and aql. Lastly, in some books say it's only to protect the property al-mal, and some scholars have added to protect al-hurma or the dignity of our own selves. And how, so basically the objective is to protect all this. So how do we determine an issue or a question or an argument is actually to protect our own maslahah? So these are some of the factors or aspects of a maslahah, of a benefit that we have to consider before discussing it. So first, how essential it is. How essential is the maslahah itself? So they can divide to 3: daruriyat, hajiyat, tahsiniyat. So daruriyat, the essentials are basically if a thing is really essential to protect life, for instance, basically like giving an emergency medication, giving emergency treatment for patient. So those falls under the daruriyat or essentials. Hajiyat, the needs, is basically things that complement or complete our lives. And tahsiniyat are the one that just embellish or just to complete our life, which we can do away without them as well. So the next aspect is for us to determine how confident we are that the maslahah or the benefit actually exists. So it divides into maslahah yaqiniyah, maslahah zanniyah, and maslahah wahmiyah. So if it's confidently existing, so we can consider it more. If there is only strong assumption or the existence of the benefit is only suspicious, so those things can be brought down forward in the list as well. So, and lastly, how do we prioritize or consider a maslahah of an issue is basically through the scope of the benefit. So if vaccination, for instance, has a collective benefit, that would trump any individual benefit, for instance. So a collective benefit would be more prioritized compared to individual benefit. Okay. And then we have to consider as well the consideration of maslahah versus mafsadah. Maslahah is benefit, mafsadah is harm. So basically, as I mentioned before, daruriyah are preferred over just needs. And needs takes precedence over tahsiniyat. And collective benefit takes precedence over individual benefit. And in terms of mafsadah, if possible, we should actually avoid any harm. Any mafsadah should be avoided as best as possible. So that's prioritized. So avoiding harm to public is prioritized over individual harm. So if we have to consider between two, harm to public and individual harm, so harm to public should take priority. And there's also a rule of fiqh that actually allows us to choose lesser between two harms. So you can read about those a bit more later on. And when you talk about maslahah of vaccination, you can see that vaccination is actually essential. So it's one of the considered of daruriyah as well, because it prevents infection, it reduces complication. In terms of COVID-19, basically, it's well known, it's evidence that basically we give vaccine to enough people, there'll be less hospitalization, less complication from the disease, and it reduces mortality, so it saves lives. So this falls under daruriyat. Next, vaccination has a collective benefit as well. What it does, it accelerates achievement of herd immunity. So if you vaccinate enough amount of people, for those who are unable to be vaccinated, will be protected as well from the disease. And this would allow social interaction, going back to normality, and will improve our outcome, not only economy and governance, etc. as well. So in COVID-19, we were all thinking about escaping COVID-19 pandemic. So vaccination can actually bring this back. And lastly, it also avoids harm. So there is a lot of mafsadah that can be avoided by vaccination. So you can reduce mass hospitalization and infection. So as you are all aware that during the COVID-19 pandemic, what happened was that the hospital was overburdened by all COVID patients. So cancer patients, patients that require other treatment were actually being neglected, we would say a bit. So giving vaccine can avoid this from happening, so avoiding a more collective harm. And then the risk of adverse effect following immunization is actually outweighed by the greater harm to public if they're not vaccinated. So people keep on talking about the fact that there's risk of getting adverse effect from vaccination, but you should consider that vaccinating enough amount of people can actually outweigh this risk, because the risk of AFI is actually quite low. All right, next, talking about the principles of medical ethics. The pillars of medical ethics, it is the most commonly discussed, are four. First is beneficence, next is non-beneficence, thirdly is autonomy, and lastly is justice. So autonomy is basically a patient or an individual has their own right to their own decision. So as a physician, you must respect the patient decision regarding their medical treatment. They have their own opinion, understanding, they have their own purpose. But to achieve autonomy, a patient has to be fully informed about the risk, about the advantages of any treatment as well. And it must not involve compulsion or persuasion. I think some people tend to be more refusal. We tend to refuse treatment if we are forcing them or persuade them too much. So we have to be aware of all these issues as well. And also, of course, when we explain about vaccination, when we explain about surgery, etc., what tends to happen is that we don't elucidate how likely it is to be successful and how great of benefit it is. So we just tend to say that patient, you need this, kena buat kan. But patient needs to be aware that how likely it is to be successful, for instance, like, or what are the risks if not getting it. So all this must be informed to patient, then only a patient can make an autonomous decision. Next, about justice. Justice is about giving a fair share, appropriate distribution of healthcare resources to all. So basically, it's about being fair, giving items to everybody that requires healthcare, for instance. Beneficence is basically doing something in a patient's best interest. We have to safeguard, defend patients' rights, avoiding harm, and promote patient welfare. Non-maleficence is just an opposite of beneficence. So basically, we try to avoid any form of harm to patients. So what about the ethics of vaccination? So the ethics of vaccination. So firstly, justice. So basically, when we achieve herd immunity, we ensure there's no strain to public healthcare system. So more people can get equal access to other healthcare support, for instance. So by giving vaccination, you can achieve this a bit more. So beneficence, giving vaccination, what it would do is actually giving benefit in terms of reducing the risk of infection and adverse effects of infection as well. Because if you know, for instance, COVID-19, what happens is that patient can get long COVID syndrome, they can get subsequent chronic lung infection, for instance. So all this will be affected as well. And non-maleficence, we're not causing harm in the fact that actually giving vaccine will reduce the risk of infection and reduce the risk of complication. Of course, there are risks of adverse effect, but again, these risks are far lower compared to the risk of getting a severe infection as well. Right, next, in terms of professionalism and about how we communicate things with patients, especially in terms of vaccination, there are the two things that we have to be well prepared of. First is being competent, secondly, to have good communication skills. So being competent is for us to have an understanding not only about a medical condition or a treatment or a surgical procedure, but we must also have good enough grasp and knowledge about the ethics and the Sharia guidelines behind it. Because if you want to counter arguments about people talking about the haramness or the why is a vaccine is a Jewish propaganda, for instance, so we must equip ourselves with the principles of Sharia and why we're doing this instead. All right. And in addition, about communication as well, not only how we speak or the content of our speech, but the non-verbal aspect of our communication is super essential as well. Eye contact, the rooms that we talk with patients to, the conditions, the surroundings, all these are actually essential in getting patients to understand. And a study has shown that communication doesn't directly affect uptake of vaccination, but evidence have shown that poor or inadequate communication can negatively influence. So it reduces the chance of us to influence patients to take a vaccination. Somebody comes to you with a 50-50 decision saying that, oh, I want or I don't want a vaccine. Good communication skills can actually tilt them towards getting vaccination, for instance. All right, so going back to the question. So first,
can you wrap it up?
Yeah, so sure. So the medical stuff is COVID-19. So first of all, of course, explanation is key. So explanation of Maqasid is very important. and communication skills would actually help in giving the risk and benefit as well. If they still refuses, we have to respect the patient's autonomy as well. There's no forcing patients taking things that they want, so we can offer alternative working condition or advise the staff itself to take enhanced self-precaution, extra PPE, for instance. And then to address parents' refusal of vaccination, again, you must actually communicate to the parents about the benefits and the risks. Even in Islam, we don't just warn people or tell people about heaven but not about the hell. For instance, what we can tell them about the benefits and risks, both of them. And if they still refuse, again, respect their autonomy, document, treat them professionally, and avoid being judgmental. So I think that is all. Sorry to take up the time.
Okay, thank you very much, Dr. Husni, with such energetic presentation, and I think you have presented your view. So I think for this, I would like to invite maybe first Ustaz Abdul Rahman to comment on the topics.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for Dr. Husni. I think cover almost most of the topics on my course and on medical side. Okay, I agree that for the vaccination, we need clinical side and Muslim scholars need to work together to explain to the public, because some of group this more respect to the religious person, so we need to explain. Okay, but I think Alhamdulillah, Malaysia, most of the ustaz ulama agree with the clinical side for the how important is vaccine. Okay. The second thing, the vaccination, I think the hukum asal hukum is maybe we can say it permissible and then maybe recommended, but we need to look to other view. If the government Walil Am say it's compulsory, so for the maslah it can be compulsory. So we need to see at the angle, but our government so far I think not give the strict enforcement. But if they want to do the strict enforcement, we can do at this angle, because this maslahat amah. So the government, they know what's the best for the all the people. Okay, I think that's all from me.
Okay, thank you very much, Ustaz Abdul Rahman. Maybe I'd like to invite Dr. Osman if you'd like to comment on the topic.
Great job, Dr. Husni. Very comprehensive once again. Yeah, I echo what Ustaz Abdul Rahman said. Maslaha and mafsada and also the hukum of things are quite gray area, because the medical faculty or the professionals here or the expertise here is medicine more than religion. At the end of the day, when we look at what is maslaha am or maslaha khas, for instance, what will be the outcome if people don't take vaccines? As you mentioned, the burden on the hospital and burden on the health system and all of these things, and other individuals being put at risk because of certain individuals not playing their part. I think this is something that needs to be thought through well and educated as well, as you mentioned before. In terms of vaccines, it is also medicine, and I think this is something that needs to be put across to people, that seeking cure for diseases is something that is in our Sharia, and it's not something superfluous to medicine, or it's preventative medicine, right? Where people think that there's a controlling factor here or a manipulation factor here. So your point of education is something that needs to be thought through. But as Ustaz Abdul Rahman said, if the government does come up with that it is compulsory, then this is a professional opinion, and we bow to this professional opinion. Jazakumullah khairan, barakallahu feekum.
Thank you very much, Dr. Usman. Thank you very much, Dr. Hussein, for your presentation. Alhamdulillah, I think we have completed until group 14 for this morning session. So now it's almost 10:15. So we will take a 15 minutes break. So we will resume our session at 10:30. I think the next group have been informed and they are ready to present. So now we can take our break and then see you back at 10:30. Thank you very much, everyone, for your presentation. Thank you to all the panels for your comments and for your inputs. And then, yeah. Thank you, everyone. Have a great break. Okay. Assalamualaikum.
مصطفى على حبيبك نبيك مصطفى. You came to me in a time of despair. I called on you, you were there with love. What would my life be to not know the unseen, the worlds between? For you I'd sacrifice, for you I'd give my life, anything, just to be with you. I feel so lost at times by all the hurt and lies. Now all I want is to be with you. Allahumma salli ala sayyidina Mustafa ala habibika nabiyika Mustafa. Showed me right from wrong, told me to be strong. Need you more than ever, Ya Rasulullah. You came to me and out of me. Need you more than ever, Ya Rasulullah. You filled my heart with love, showed me the light above. Now all I want is to be with you. You are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala sayyidina Mustafa ala habibika nabiyika Mustafa. Allahumma salli ala sayyidina Mustafa ala habibika nabiyika Mustafa. Be with you, you are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala sayyidina Mustafa ala habibika nabiyika Mustafa. You came to me in a time of despair. I called on you, you were there with love. What would my life be to not know the unseen, the worlds between? For you I'd sacrifice, for you I'd give my life, anything, just to be with you. I feel so lost at times by all the hurt and lies. Now all I want is to be with you. Allahumma salli ala sayyidina Mustafa ala habibika nabiyika Mustafa. Showed me right from wrong, told me to be strong. Need you more than ever, Ya Rasul. You came to me, and of me, need you more than ever, Ya Rasulullah. You filled my heart with love, showed me the light above. Now all I want is to be with you. You are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. Be with you, you are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. You came to me in a time of despair. I called on you, you were there with love. What would my life be to not know the unseen, the worlds between? For you I'd sacrifice, for you I'd give my life, anything, just to be with you. I feel so lost at times by all the hurt and lies. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. Showed me right from wrong, told me to be strong. Need you more than ever, Ya Rasulullah. You came to me, and of me, need you more than ever, Ya Rasulullah. You filled my heart with love, showed me the light above. Now all I want is to be with you. You are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. Be with you, you are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala habibika nabiyika Mustafa. You came to me in a time of despair. I called on you, you were there with love. What would my life be to not know the unseen, the worlds between? For you I I'd sacrifice. For you I'd give my life, anything, just to be with you. I feel so lost at times by all the hurt and lies. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika Mustafa. Showed me right from wrong, told me to be strong. Need you more than ever, Ya Rasulullah. You came to me in the hour of need. Need you more than ever, Ya Rasulullah. You filled my heart with love, showed me the light above. Now all I want is to be with you. You are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika Mustafa. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika Mustafa. Be with you, you are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika Mustafa. You came to me in a time of despair. I called on you, you were there with love. What would my life mean? Not know the unseen, the worlds between. For you I'd sacrifice, for you I'd give my life, anything, just to be with you. I feel so lost at times by all the hurt and lies. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika Mustafa. Showed me right from wrong, told me to be strong. Need you more than ever, Ya Rasulullah. You came to me in the hour of need. Need you more than ever, Ya Rasulullah. You filled my heart with love, showed me the light above. Now all I want is to be with you. You are my one true love, taught me to never judge. Now all I want is to be with you. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika Mustafa. Allahumma salli ala Sayyidina Mustafa ala Habibika Nabika
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Okay, welcome back to the last session for our course. Inshallah, we will continue the presentation. So I will be your moderator, Dr. Muhammad Shahril. Okay, thank you for all this panel. Inshallah, we will continue another 4 groups for the presentation under the topic of ethics, the theme of ethics, professionalism application in the clinical issues. Okay, inshallah, if I would like to invite the group 15.
Assalamualaikum and good morning. So I will be start sharing my screen. I start from the beginning. Okay, Assalamualaikum and good morning to all professors, doctors and fellow postgraduate. I'm Hidayah, a representative from team 15. So our group is supervised by Assistant Prof. Dr. Iqbal Munawir bin Abdul Rashid, and the followings are my teammate, which is Dr. Siti Ani Nazira, Dr. Sarmani, Dr. Guna Nesan, Dr. Ezanatu Ezura, Dr. Siti Nurul Alia, and as well as me. So we are given 3 questions for our discussion. So I'll start with the first question. So for question 1, a son comes to health clinic and requests hypertension medication for her mother who had defaulted for 1 month and unable to come appointment for logistic reason. So for this question, how would you respond? So first one, we should explore the reason why the patient default the appointment. Then we need to explain to the son that we need to assess the patient current condition as well as BP control in order for us to assess the sign and symptom of target organ damage and also the compliance of the medication. We need to advise the son on continuation of proper care and also necessity to take antihypertensive medication. And also we can advise the son to help the mother or the patient to follow up properly in order to detect early probable complication that may arise from her underlying medical illness. And lastly, we should also discuss with the son and also patient whether they have any preferred GP or nearest KK that they would like to be continue their follow up, and we can provide them with memo to the respective KK. And from this scenario,
Sorry, Dr. Slide dia kecil.
Okay, sorry Doktor. Kejap. Saya...
Daripada handphone.
Ya, sorry Doktor. Macam ni boleh ke?
Okay. Dia better.
Okay. Then, so for this scenario, it involves the 4 principles of the medical ethics, and the first one is the autonomy, where the patient option and background should always be considered when discussing and explaining the management option. And then in this part, we need to respect the patient decision, and also we need to discuss the patient regarding the awareness of the risk and also the advantage of the treatment. And secondly, it is the beneficent, where we need to defend the patient's right, avoid harm, and also promote the patient welfare, where we need to advise the son to help patient to have proper follow-up and also proper assessment. Next one is non-maleficent, where we do not do harm to our patient, where we need to outweigh the benefit against harm of all medical procedure and also the treatment. And the treatment we will be given should be with fully assess the patient condition and also tackle the issue related of the patient. And lastly is justice, where we need to treat equal and fair share and also appropriately distribute the healthcare resource to all, in which if patient keen to be follow up to other different health clinic, we can provide memo to the patient to continue follow up at the nearest health clinic that she want. Then in this scenario also, it emphasizes the fundamental and the primary objective of the Sharia, where the realization of benefit to mankind in this world and hereafter by bringing the benefit and preventing corruption and also evil. As one of the 5 pillars of Maqasid Sharia is protection of life, because life is essential and also valuable to everyone, thus it must be protected at all costs and in all circumstances, where protecting everyone's life is equally important and obligatory to each and every individual and also society, regardless of their status. Apart from that, a principle of doctor and patient relationship, where patient-centered care will help patient to be more cooperative with follow-up given. Apart from that, a partnership approach with 2 parties agree to a common goal to achieve and maintain a good outcome of the condition or disease using agreed management option, rather than the doctor's responsibility to dictate the management decision. A doctor's role is to identify possible solution to the medical problem based on their professional option and also guide the patient to make the best decision. And for the second question, you are in ward when patient who are terminally ill request for medication to end her life as she is unable to bear her pain anymore. She has been diagnosed with stage 4 lung carcinoma with multiple sites of metastasis. How would you handle this situation? So as you all know, this patient has a terminally ill patient who has severe unbearable pain from stage 4 lung cancer, and it is non-curable. So the main aim of treatment for this patient is mainly palliative care to relieve the pain. Apart from that, pain control for this patient might be sufficient. As a doctor, and we need to assess this patient and also give appropriate analgesic. Patient also should be counseled regarding the need of spiritual and also religious support as she is thinking about ending her life. She also has to understand the concept of qada and qadar and 5 pillars of Maqasid Sharia, which is the preservation of life. In cancer pain management, morphine is the drug of first choice for severe pain, cancer pain, and the titration of dose should be according to the pain and also respond to the morphine. It is the main principle. For the spiritual care, it is one of the core aspects of palliative care, and it is not only related to one faith, but it is to do with how we live, how we treasure and value, and also peace of mind. The religiosity is the manifested action of one's spirituality or the practice ritual of an organized belief. So as one of the 5 pillars of Maqasid Sharia, where is the preservation of life, Islam consistently emphasizes the importance of preservation of life and well-being. Therefore, Muslim, the follower of Islam, has no right to end their life. What is euthanasia? Euthanasia is an act or practice of painlessly putting to death for persons suffering from painful or incurable disease or incapacitating physical disorder, or allowing them to die by withholding treatment or withdrawing artificial life support measure. This definition is from the Britannica Encyclopedia. And have you heard regarding passive euthanasia? Is it the same with the withdrawal of treatment? So passive euthanasia is omission of an action that deliberately letting the patient to die. It can be either not doing something necessary to keep the patient alive or stopping doing something which keep the patient alive. While withdrawal of treatment is withholding, withdrawing, and refusing medical treatment, do not resist and discontinue life support machine. So for passive euthanasia, euthanasia is actually a haram in general, including passive euthanasia. But to accept the withdrawal of therapy, we have to differentiate these two based on the intention. So for passive euthanasia, the intention is to kill, as patient may still benefit from the treatment. However, while withdrawal of therapy is the intention is to let the disease take its course, and patient usually already in infertility. So despite in withdrawal of treatment, the patient should still continue to receive the basis of human right of hydration, nutrition, nursing, and also pain relief. And as for qada and qadar, we need to explain to the patient that Muslim believe that men are created to serve the Creator, and the practicing Muslim will align their thought, speech, and action according to what will please Allah. And the Muslim must understand God knows everything in pre-eternity, including what happened and what will happen, and His order determine the time, place, and characteristic of the event. So next question. For question 3, a patient requested specifically for celebrate for her headache at your head clinic. Upon your assessment, her pain score is 2/10 and there is no contraindication to give paracetamol or other NSAID. But patient requested for COX-2 inhibitor as she believed the medication is much better than NSAID. So for pain management, the management of pain should be based on WHO analgesic ladder, where the fundamental concept of the ladder is that it is essential to have adequate knowledge about pain, to assess the degree in a patient through proper evaluation, and to prescribe appropriate medication. As this patient pain score was only 2, which is mild, so she should just receive the step 1 ladder, which is non-opioid analgesic or plus adjuvant analgesic. And Celebrax, it is a COX-2 inhibitor, which is a selective NSAID. It is different compared to the previous traditional NSAID, which is non-selective, and it has advantage of avoiding the side effect relating to stomach and also intestinal problem.
Dr. Hidayah, slide tu dia bergerak.
Oh sorry. Alamak, sorry.
Belakang. So you have the master dah ni. I give you 1 minute lah to conclude.
Okay, sorry. Okay, so for discussion of the medical ethics, so in this scenario, it involves the autonomy and also the beneficent, where every patient have different level of education, understanding, and financial status, which influence the medical management. So we need to understand the patient problem in their own perspective. So once we understand the patient problem, we're able to lead to the patient to the adherence of treatment and also good response to the disease. Apart from that, as this patient, he might have already done her own research regarding the type painkiller that available, and she thought that Celebrax might be have lesser side effect compared to the national side effect. So, as for the autonomy, we need to respect the patient decision as she wants to take the Celebrax. However, considering the cost effective and also limited resource of each medication, we need to explain to the patient. We need to explain to the patient that in her case, he does not need the Celebrax, and Celebrax is usually preferred for high risk patient, which can have develop side effect from the traditional NSAID. And apart from that, as for the doctor-patient relationship, it's also important that patient make fully informed decision in terms of doctor-patient relationship, where seeking medical treatment and also advice, while the duty of doctor is to do justice when treating the best of their ability, non-judgmental, sympathetic, polite, and also cooperative. And lastly, in this scenario, Muamalah concept in medical practice, the partnership approach in which both parties agree to a common goal, and human lives need to be preserved as much as possible. So, in conclusion, this patient symptom need to explore more and need to determine the cause of the pain. And apart from that, we need to explain to patient the option available other than Celebrax. And also, we need to consider to reserve the medication for the patient, other patient who would benefit more from it. Thank you. That's all.
Okay, thank you Dr. Hidayah for the presentation. Your slide tu dia tak bergerak sikit. Okay. So, okay, thank you. So, invite our panels. Dr. Datuk, do you have any comments?
Inshallah, it's a very good deliberation, quite comprehensive. Just going back to the idea of autonomy of the patient to make the decision based on advice and input upon the doctor. So this is where the doctor-patient relationship is of cardinal importance. So I say the first one. cardinal important, that the patient has trust in the doctor. So this is where the itqan that was mentioned in the morning session, the excellence that is mentioned, people tend to put the measurement of itqan is the fulfilling the standards, and then in the best of form, and then sincerity and so on. But I would say is that as a rule of thumb, that when you do your job, are you satisfied enough to bring this job that you have done and present it to Allah subhanahu wa ta'ala, hoping for His mercy to accept it? This is the thing. So it's like, doing your utmost in your sincerity, doing your utmost in terms of getting your professional skill up to the mark, doing your utmost to have the what they call it, the psychological knowledge, doing your utmost to have the communicative skills and so on. So this is what I'm saying, that doctors are special being selected by Allah subhanahu wa ta'ala to fill this very noble job of taking care of the human body, that super entity that has been created by Allah subhanahu wa ta'ala himself. So I would say that build that trust between the doctor and the patient. That is the bottom line. Thank you.
Thank you, Dato', for your comments. Prof. Amin?
Bismillahirrahmanirrahim. I think the presentation is very good, and then they have mentioned all the principles that they need to take for all the cases that we are discussing. Just I want to highlight regarding the now medicine is when it comes to the relation between doctors and patient doctors interaction. We have to put more weight for the patient-centered care, in which patient need to involve in their management. Patient need to be informed completely, then understand it, what have happened or what should be happened, the management of the patient, which is I think is not only from the Islamic perspective, but also, if I'm not mistaken, the WHO have come out with the principle of the patient-centered approach for managing in at least in the hospital as well as outside when patient out of the hospital. This is another one, and the second part is. In terms of the mercy killing, which is I think is something which is already discussed in length in various platforms. But for us, we need to know that our limitation as doctors, in which we can't really decide on the life of the patient. And in our opinion, in the Islamic view, prolong the life actually is more important, because by prolong the life, we give a more chance for the patient to perform more things, ibadah, and more kita panggil taubat, everything. Make sure that everything patient actually is already calm, everything. And this is things that we actually is need the patient to understand, because our job actually is to the agent of the healer. We are not the true healer. This is, I think, something which is important for us to understand as a doctors. Thank you.
Thank you, Prof. Amin, for the good comment, and Dr. Amidun. And okay, inshallah, we will proceed with our group 16. Are you ready, group 16? And please be reminded that you have 10 minutes for presentation, and then we have we will have the feedback and comments after that. Dr. Afifah.
Assalamualaikum warahmatullahi wabarakatuh. Can you see my slide?
Not yet.
Yeah.
Okay.
Right. So I will begin. I'm from group 16. Our supervisor is Assistant Professor Dr. Muhammad Syarif. Our group members consist of Dr. Cindy, Dr. Zamhira, Dr. Nur Afiq, and myself, as well as Dr. Shifa and also Dr. Gita. So before I start, our group have been assigned with 3 tasks regarding LGBT group. So for the introduction, what is LGBT? So LGBT is a sexual disorder which is within the community of the lesbian, gay, bisexual, and also transgender. But this is not a new issue in the community. Instead, Allah has explained about the homosexual problem that occurs among people of Lut in the Al-Quran, where the homosexual is clearly a despicable act, as mentioned in the verses of Surah Al-Araf 80 to 84, which translate as, "And we have sent Lut when he said to his people, do you immorality as no one has proceeded among the worlds, indeed you approach men with desire instead of women. Rather, you are transgressing people." But the answer of his people was only that they said, "Evict them from your city. Indeed, they are men who keep themselves pure." So we saved him and his family, except for his wife. She was one of those who remained with the evildoers, and we rained upon them a rain of stone. Then see how was the end of the criminals. So moving on to our first task, what are the implications of practicing LGBT towards the health in terms of biological?
Tukar presentation mode. Okay. Presentation mode. Ini dia presentation mode ya. Tepi sekali. Ya.
Oh, sorry. So what are the implications of practicing LGBT towards health in terms of biologically, socially, psychologically, and spiritually? So for first is biologically, there are no inherent biological health implications associated with being LGBT. Sexual orientation and gender identity are natural variations of human diversity. However, LGBT individuals may face specific health challenges due to societal factors such as higher prevalence of mental issues, substance abuse, hormonal therapy, and sexually transmitted infections. So access to affirming healthcare and appropriate health education are essential for addressing this concern. For socially, LGBT individual may face social challenges due to the societal stigma, discrimination, and also prejudice. This can lead to social isolation, exclusion, and marginalization. Lack of acceptance from family, friends, and society can lead to increased stress, anxiety, depression, and lower self-esteem. These factors can impact social relationship, sense of belonging, and also overall social well-being. Supportive communities also, equal rights and inclusive policies can contribute positively to the social health. Psychologically, this LGBT group people may experience higher rates of mental health issue, as I mentioned before, and they also, these challenges can be attributed to the minority stress which arises from the experience of the discrimination and prejudice. Access to the mental health service, including culturally competent therapists, can help to address this concern and promote for the psychological well-being. For the spiritual, the implication of LGBT's identities can be vary depending on the cultural and religious belief. Spiritual health is deeply personal and individual aspect of well-being. Some religious tradition may have, most of the religious have a very negative attitudes towards homosexuality and transgender identities, which can create conflicts to the LGBT individuals. So for individuals who spiritually is important aspect of their life, finding the affirming religious or spiritual communities can contribute positively to their overall well-being. So how to approach this LGBT group? First, by only engaging with this issue holistically, that we can properly understand and respond to these challenges. We can apply the principles of professionalism, which is the commitment to patient honesty and confidentiality when this patient came to health practitioners, which is us. We first thing need not to judge as stereotype and try to understand the fact that people come from different background with different upbringing. Besides that, professionalism from Islamic perspective view, which is the fundamental principles such as faith, taqwa, and also amanat can be applied. We can form networking to this LGBT group and making two ways of communication so that the communication will be more effective. So other than that, characteristic of professionalism in Islam, which is Ansar, which defined as willing to help, need to be applied for the healthcare. We can help to organizing seminar, classes, workshop for basic Islamic and spiritual knowledge specifically for the group, as they might be intimidated to join formal classes with other people. By providing this healthy environment, we can slowly guide these people towards our two basic fundamental in Islam, which is Al-Quran and Sunnah. Besides that, from all the, when they have been honest to you, you need to be trustworthy or amanah with them, and so that they can trust us in helping them towards to be a better person. So to provide social and also psychological support is also important for this group, as this majority, as I said, is vulnerable towards especially mental health concern. Right. Our last task is how to approach a male patient who requested for prescription of hormonal tablets in order to enlarge his breasts. So first things first is back to the basic. First, when you encounter this kind of patient, we need to respect and set a good standard for inclusive care. Avoid being negative, giving any negative facial reaction or judgmental remarks, or any offensive language, as they might not be totally honest with you during the encounter. Consider this patient psychology as well, motivation for why the patient decided to have hormonal pills, and also explore towards her emotional stability during the consultation process. Look for any underlying body dysmorphic disorder, any excessive or unusual encouragement, which may lead to the procedure of asking for the hormonal pills. Any unrealistic expectation and other factors influencing the desire need to be more explored during the consultation. After that, we need to explain the patient regarding the complication of taking these hormonal pills. We need to mention that the hormonal pills, unsupervised specifically hormone consumption, may result in developing complication and morbidities. As a health professional, we need to advise this patient to seek counseling for any agencies or any specialized in dealing with these issues. We also have the we also need to counsel the patient on the social and religious implication on this gender assignment, and we need to be holistic when approaching this kind of people, and we can help to guide this patient for a better health education, and as well as at the same time giving an Islamic preaching suitable for the Malaysian setting. That's all.
Okay, thank you, Dr. Afifah. Oh, this is one of the, I think now recently in our country become a very sensational hot topics regarding the LGBT, and then a lot of comments, a lot of I think opinion from the public, and also from the all the government sector. So I'd like to open for the panel for the comment. Dr. Osman, you have any comment?
Assalamualaikum. Once again, excellent presentation, Dr. Afifa. Very good, very comprehensive. I like your well-rounded approach that you've taken, all the dimensions of seeking counseling and different various groups. The only thing that I generally advocate with my students is this, that while we have a clear hukum in Islam, where we stand on this topic, as a medical professional or a person in the health profession, we do see the homosexual and those that have chosen this type of life as a human being first, and we treat them based on this. The hukum of them is one thing, but of course we take the humanity first. As many scholars have said, just give me a minute, please.
Sorry.
As many scholars have stated that it's the act that is despicable, but the person is still a honored creation of Allah subhanahu wa ta'ala. So we separate the act from the individual. I think this is something that we do need to keep in mind whenever we're going forward and whenever we're interacting with other individuals of other faiths and other viewpoints as well. This is just my 2 cents. Jazakumullahu khairan, barakallahu feekum.
Okay, thank you, Dr. Osman. Prof. Ibrahim, any comments regarding this presentation?
Yeah, this issue again, it is an area of religion and science. And I think even the religion has more history about this, as indicated by Dr. Osman and also presented by the presenters, our doctors. So the issue is has very sad implications to the community, not only for medical issues, but also if this became something so common and so familiar, then the two objectives of Maqasid Islam cannot be fulfilled. That is progeny and also life. Because as we know, if we imagine around, let us say the majority of people start to be LGBT, then within maybe 200 years, then the human nation going to extinct. So we need somebody to rescue us. Now we are taking care of animals, those who are endangered, to survive. So the humanity voluntarily bringing this issue to the human community. So far, I think as Muslim, we are safe. But this thing sometimes is being adopted by other communities and coming here and there. So we need to emphasize about our culture as a Muslim. Or not only Muslim, even all religions. So the Eastern religions, as we know, even composition, what we call the all religions, including Indo, this is usually they are against this kind of practices. And many even in the what we call very original communities, aborigines, usually they are against this kind of acts. But I don't know, in all cases, there is two dimensions to be addressed, medical and also social. And then the religion can play a role to bring the people online. Okay, luckily, alhamdulillah, the cases are not so many. But we need to be vigilant and also, especially for the educated people all together, not only medical doctors, but all the educated people should play a role together with the religious people to bring down at least the normal way of reproduction and also satisfy our needs there, because Allah subhanahu wa ta'ala gave this power for another purpose, not for our own purpose. Okay. Thank you very much for discussion, and thank you also for the presenter. I think well done.
Thank you very much, Pak Ibrahim.
May I give?
Yeah, You want to comment?
This is a very good exposition, quite detailed, and I see the urgency of having an integrated approach. So I'll be presenting as well. I'll be proposing to the Department of Interdisciplinary Studies that the approach should be interdisciplinary. The doctors will mention about the details of it, and especially the psychiatrists, and the psychologists should be coming in. And then the idea that is this natural or not natural, the concept and so on and so forth, we can trace it back, especially if this is a world-class, world level movement now, is basically the atheistic and postmodernist push. And now, because the US are under the Democrats and they want to show something that are different from the traditionalists in the Republicans, and they are pushing this in their time. However, to understand this, we not only from the Islamic context, even from the human level context, if we go into the YouTube, I have gone into hundreds of it, right? Names like Matt Walsh, names like Ben Shapiro, names like even the clinical psychologist Jordan Peterson, you'll find that even in the West, even in the US, where they're trying to make it into law, people are fighting back. The Christians, the non-Christians, and so on, they're fighting back. And there's a case now up in the Supreme Court of the US whereby parents want back their power over their children, right? And not the school system. So as the Muslim community, I would say that we should emulate the Africans in this. You know, when Yoweri Museveni, former president of Uganda, gave his opinion, explained his opinion, then it could become very, very, very clear. And I think we shouldn't be defeatist in our stand. Right? We should argue that, even from the scientific point of view, the XX chromosome, the XY chromosome, and this sort of thing, the concept that it is social construct, the gender is just a social construct, then, there are words that are, as mentioned by one of the teachers, those are just words, and you put your interpretation to it. But the real thing is the biological and the fact. I mean, we should be aggressive about it. So it must be a multidiscipline. We do something, we write a paper, we write, go on talks, so we go on the road show and give talks about our input on this. So thank you very much. I would think that's it. The other part I would like to add as well is that when we go into the Maqasid Sharia, for the future, I think we should also be thinking about, I think the Sheikh, the director of the Maqasid Institute, Yasir Auda, is still here, I think. And the idea that Maqasid is a point, reference of preventing or protection of life, akal, and so on and so forth. Whereas inside traditionally there is 5, right? But then you see, in addition, we see in one of the presentation, the kehormatan is also part of the dignity of human being. Is also part. Then you find that in our Western heritage of Islamic knowledge, they consider that any maslahah amma big enough can also become a maqsid muaqqad. At that time, it becomes the maqsid, become an objective religion. So I would say that it would be better for us later on to think about, even in medicine, even in healthcare, that Sharia is not a maqasid is not a 1-point minimum. It is rather a range from that 1-point minimum to the optimum. So, for example, life, prevention of life. That's it. That is the field of the doctors and so on. But then improving the quality of life, this is another thing, right? So, and the akal as well, to prevent the akal from losing the akal or diminishing some parts of the thinking process. From there, not only there, you should, as far as Quran is concerned, Islam is concerned, you have the obligation to improve your akal, your thinking capacity to the maximum. What is the maximum? That you can see the signs, the hands of Allah in all the creation and even in yourself. So I think later on we can develop on that area as well. Thank you very much.
Thank you very much. Very true. Okay, Alhamdulillah. I think lots of comment regarding this issue. Inshallah, I think like Dato said, inshallah we have to do this. This issue must be tackled as integrated multi departmental punya involvement. Okay, inshallah. Thank you, Dato. And you to all the panels. Okay, inshallah we proceed with the group 17 for the presentation. Are you ready? Afiq, Dr. Afiq. Okay.
Yes, I.
Okay.
Okay. Ya, saya nak share. Bro, saya tak boleh nak share my.
Kita allow je share sepatutnya. Tak boleh share?
Tak boleh share. Dia kena buat jadi saya jadi co-host kot, bro. Okay, ya share screen. Okay.
Okay, buat presentation mana? Okay, nice.
Alright. Assalamualaikum warahmatullahi wabarakatuh. To all professors, lecturers, and fellow postgraduate students. Actually, I'm representing my group 17, which being supervised by Assistant Prof. Dr. Muhammad Iman bin Saiful. So our topic for IIMP this session is about breast milk bank. So this is my fellow group members, Dr. Wan Nurul Nabita from Family Medicine, Dr. Sito from Radiology, Dr. Shazana from ONG, Dr. Rachel, Anesthesiology, and Dr. Nurul Izzah from Ophthalmology, and me, Afiq bin Alias from Surgery. So beforehand, this is my table of content for this presentation. First of all, we will introduce introduction, criteria for milk donors, steps in donating the milk, importance of a milk bank in hospital, benefits, and issues related, and as well preparation of the milk bank services. So first of all, for breastfeeding mothers, there are certain reasons for breastfeeding mothers who are unable to provide formula milk. Number one is HIV patient infected mothers, untreated active TB mothers on chemotherapy treatment, unable to produce sufficient milk, injury to the or death to the infant's mother, financial constraint, and also unavailability of the formula milk, and also the short supply. So thus milk bank should help with this issue. So what is milk bank? It's a service facility which takes human milk donation and distribute them to whose need and not related to the donor. So the service includes the screening of the mother, and also collecting the breast milk donation from the mother, processing in a certain way, SOP, and also safe for consumption, testing for safety and nutrient of the breast milk content, and as well keeping records for the milk donors and also the recipient. So the infant can receive this milk include especially premature babies or victims of the maternal loss or injury, offspring of mothers who are unable to produce milk, which benefits them to reduce infant morbidity and mortality, and as well to ensure optimal physical and neurological development, and might save cost effective to reduce NICU and also care. So the next part is the criteria for milk donors who are qualified, which is number one is a lactating mother who is in a good health related behavior, not on any regular medication or herbal supplements, exception for those prescribed on prenatal vitamins, insulin, and such as, etc. And also they willing to undergo blood testing for infection screenings, and also has adequate milk for her own baby, and also her own child is thriving. So what the others which kind of mother who has not qualified for, to be a milk donors. Number one is usage of illegal drugs, tobacco, or regular alcohol intake, or 3 caffeinated drinks per day, positive HIV, Hep B or Hep C, syphilis. The donors, sexual partner is suffering from infection, hepatitis B, especially HIV. And also, if the person is an organ or tissue transplant receiver, or or she had a blood transfusion product within the 12 months period, and also on chemotherapy drugs, as I said before, and also ongoing infection towards the nipple or the areola, or over the breast side. So for the next part, how does the steps in donating milk? Number one is screening. So from the first part, we need a proper counseling. The donor as well need to fulfill the criteria, need a consent from the donor itself and also the partner, the husband. Proper history taking and physical examination, and as well laboratory tests. And secondly, once we settle the screening part, milk collection. So the donor need to be sent to a designated breast milk collection and need to collect it hygienically. And for the milk process, you need to have a strict SOP with a strict hygiene. Need had flows, okay. The sample need to be flashed, filtered, homogenized, pasteurized, and also need to further strict SOP. So for the milk testing itself, it need to be pasteurized, which is decontamination of any pathogens, and also need to be dispensed to the infant who's in need, post-pasteurization, and there's no growth of any bacteria or fungal. So for the storage purposes and also distribution, so the milk sample should be freeze up in an industrial freezer up to 6 months, and also can be distributed according to an ICU physician after being consented from the recipient. And the most important thing is labeling and records, because from here you can we can trace full traceability from the individual and also the recipient, the records, and also confidentiality. So these are the table from what I've explained, from the selective donor until the allocation to the infants. So for the next part is important of a milk bank in hospital. Usually the donor milk is being given to high-risk newborn, which is admitted to the NICU, neonatal unit. So it can as well being delivered in an ICU setting, because the staff and medical staff can easily provide administrative supervision, and also it increased rates of exclusive breastfeeding for the very low birth weight child. So in this case, the importance as well, it can spread awareness of milk bank to its purpose for large numbers of mothers and staff for the future donors, and as well, to be implemented on the awareness is by human milk donation campaigns. So eventually the benefits of milk bank. So it can be categorized by babies, mothers, and healthcare. Of course, for the infants, it reduces the risk of infection, and also significantly decrease in mortality in a very low birth weight child population. And for the mothers, it reduces the anxiety for her because you are unable to feed her infant. So this can substitute for the mother purpose. And also for the community, it reduces the healthcare costs and burden. So what are the implications of breastfeeding in Islamic region? In Islam, basically breastfeeding is highly applauded in Islam because it shows a sign of love between the mother and the child. So every infant has a basic right to breastfeeding. So for the concept in breastfeeding in conjunction to milk bank, so the thing that most people are aware, or thinking it's mahram by breastfeeding. So by receiving breast milk from another woman, to the infant of own mothers creates a milk kinship. So this kinship is called mahram, which prohibits marriage to or other religious prospect in between the wet nurses or the nursing mother to the recipient. So in these three conditions which creates mahram relationship in Islam is basically for the wet nurses. So wet nurses basically on Shafi'i prospect, Mazhab Shafi'i, the wet nurses must reach the pubertal age, and in Maliki scholar, she, they argue do not have to reach pubertal age, but in consensus for Shafi'i, it must reach a pivotal age. For nursling's age for the child, according to the Shafi'i school of thought, the infant should be not more than 2 years at the first breastfeeding initiation. So as the quantity of the breast milk, the child, according to Maliki school of thought, and also Shafi'i and Hanbali, the child, if they breastfed the child until satiety, satiate more than 5 times, so the child is considered as mahram. Okay, so for concept of mahram again, in Quran, in Surah An-Nisa, Allah mentioned that it is forbidden to you to marry your mothers, daughters, your sisters, and then your aunties from your father and mother's side, and also from your niece and nephew, which is the sons and daughters from your own brothers and sisters, and as well from the Ibu Suswanah, basically from the wetness. So
1 minute. Taufik,
yeah. So the issues related to the milk bank is basically according to the fatwa in 2011. In major Muslim country, the protocol is pooling of milk, multiple mothers, and anonymity of donors and recipient, which does not comply to the Islamic law. So in this, in Islamic law, we need to protect the lineage and decency, and also this had a very, debate in fatwa committee back in 2011, because this is the main issues from that fatwa, either the recipient and also the the background of the wet nurses, and so the milk donor, and also the lineage lah, mahram, and also. So lastly, the preparation of the milk bank services. So to study on the establishment of the milk banks itself, and as well on the operation, technicalities, and maintenance. So number 2, to discuss with the Muslim religious leaders to establish proper Islamic law guidelines to support or to protect the milk kinship relationship between the recipient and the donor. And also, like I said, a comprehensive SOP with compliance with the Islamic guidelines. And the 6th condition of the Sharia compliant is basically, number 1 is the consent from the husband and the donor. Number 2 is the kinship, which is the mahram kinship, and also the amount of feeding, and as well the protocols or the necessary records to being to kept for the families who receive from validation from the Ministry of Health, and also the religious council if the child is being declared as milk kinship. So the establishment, as we know, suspect had a milk bank, Halimatus Sa'diyah Mother's Blood Bank. So these are the main concept for the establishment of the Halimatus Sa'diyah Blood Bank. So as I said in the fatwa back in 2011, penubuhan bank susu tidak diharuskan, but this for our milk bank is being established on based on the Maqasid Syariah, and also according to Islamic law. And so for the milk bank itself, it need to be halalan thayyiban, which is the assurance and guarantee that both the milk which is being integrated into the holistic and balanced requirement and also application needs. So it's need to be Sharia compliance. And I think this is a brief diagram. So in conclusion, and so recommendation. So human milk bank is indeed permissible. It does not weigh more good than harm, but it helps babies and also donors. I mean, from the baby's perspective, they will get a gold standard nutrition from the breast milk, and also from the donors. If the mother suffers from hyperlactation, that means the milk is hyperproduction. So they can, they can favor many parties, especially in popularized Muslim countries, primarily in Malaysia. So the last three is establishment. In our neighboring country, Singapore is a good example because they already had a establishment of the milk bank. And also, the lastly for our Yusuf Al-Qardawi, before that, he had his research on human milk bank to relevant in Malaysia because it gives benefit to babies, especially for premature babies. So these are the last part of my presentation. There's a newspaper articles on Halimatul Sa'adiyah Milk Bank. So back in 2022 during the opening, so it's been covered by a few newspaper So I think that's all for my presentation. These are the references, and also thank you.
Thank you, Dr. Afiq, for the nice presentation. So for the panels and comment, Osman.
I don't have much comment. Very good presentation, very comprehensive. It is much needed in our times, a milk bank. And as you are rightly highlighted, I think the biggest issue in Islam is traceability, right?
Yes.
From the Islamic perspective. But I think a drive to bring back breastfeeding and breast milk as a sustenance for babies is something that needs to be highlighted. It is also sort of a sunnah, according to some of the scholars, to share breast milk between different people, as the Prophet himself was breastfed by Halimatul Sa'adiyah, as your breast bank is named in the hospital. So great presentation. Jazakumullah khairan.
Thank you, Bob.
Thank you, Dr. Osman. Dato, any comment?
It's only about you mentioned about Dr. Osman, the traceability. Perhaps instead of a milk bank for non-baby in what do you call it, in Daruri situation, we can have volunteers of breastfeeders. Then registered, and we know who gives feed who, right? Then that is on voluntary level. It's just like in Prophet's time, they pay breastfeeders, right? That is number one. Number two is the time of darura. So this we need to get together with those in Baldis Fatwa. For example, a newborn baby that needs milk, so that will come from milk from the milk bank, and it is, you don't know who has given this milk and so on and so forth. But this is the situation of darura. We don't feed him, then he's gone. So this is, you know, darura always make things haram become salah. Thank you.
Right, thank you. That's all.
Thank you, Dato. Okay, thank you.
A very short comment. I think the area is totally new, even though we have history of this as being indicated, but community is not familiar with it. So you will face challenges. So these challenges, two types of challenges. Challenge of the medical perspective, that is, as you mentioned, the process of screening, not to bring the disease from the donor to the recipient and so on. Yeah, the recipient. That means it is this medical perspective. The second is also community. Community is not so familiar. Even though Dato and also Dr. Usman, they say it is maybe sunnah, but in fact, the people are not easy to adapt this. It is before Islam, actually. Our Prophet being fed before Islam, not within the Islam. And Islam changes so many things in the Jahiliyyah time. So our Prophet being fed, of course, that is being recorded and we know. But it is practice it within the Islamic time or not. But in many cases, as we know, the people usually feed the children without knowing the reason. For example, the two sisters, usually one of them go to work, the second feed both of the child.
Yeah.
And this is the issue which you mentioned about the mahram will arise there. So I'm not quite sure, do the Malaysian community altogether already accepted the idea or not? Even though idea is very useful, it seems that you are going to rescue us. That is why that will say it is darura. Rescue the maybe premature children or babies and so on. So I think the challenge of this will come. So you need to be creating more motivation, more better ways to the community to accept, and also make more conscious, what we call more serious ways to adapt the steps which you mentioned, starting from the screening up to maybe keeping the milk in the bank, because if milk get prosak and then give to the babies got to die. Instead, if rescue, no, let them to go to the to death. So what I mean is the whole idea is really need serious steps to avoid so many things. One question which I was putting, maybe or I have in mind, I took long time, but do the what we call milk feeding by the bottle or by bank milk bank, is it regarded as breastfeeding or not? Or that means do leading to haram, for example. The child feed from one person who is a donor, and this person may be known by the doctors. Okay, the name is not kept anonymous. So and then the recipient also know. So this will establish mahram or not? This is number one. Mahram. Yeah, maybe I give one scenario.
Okay.
This is Tesla.
Okay.
A man get lost in jungle with his wife and newborn baby with very little food. So when the times go on, then the food get scary. So they decide that the food is to given to his wife, who is the mother of his own baby. And then both the husband and the baby will feed from the wife. Minimum from them. Okay. So this is just scenario. You think about it, because this issue really creating so many concerns and questions. Thank you.
Okay, thank you.
Thank you.
All right, Brian, for the scenario. Okay, thank you.
But you just mentioned, the doctor mentioned that it's 2 years, right? After 2 years, it's not considered anymore.
Yes.
Right? Yeah.
I think they have a very strict record and also
Sorry, that way you solve the problem. I give problem to the exam.
yeah.
To the recipient, so that way you should not include there. Of course, you can go to Darura also.
Yeah.
Okay. Thank you very much for the comment. Okay, thank you, Dr. Afiq.
Thank you.
So we go to our last group for presentation today, group 18. Okay.
Can I share my screen?
Yeah, okay.
Oh, sorry, I need access as well.
Access, okay. Can you give the co-host?
John.
Okay. Can? Boleh?
Yeah, just hold on, Baba. Sorry, my. Good morning, everyone. Can you see my screen?
Yeah, go for presentation.
Okay.
Okay, nice.
So good morning to all experts, lecturers and doctors. My name is Kok Chu Kian, where I'm representing Group 18 to present on our topic. So we are supervised by Assistant Professor Dr. Edric bin Muhammad. Sorry, cannot see. Supervised by Assistant Professor Dr. Edric bin Muhammad Aidid, and my fellow team members, Dr. Nur Emilia, Dr. Kui Hong, Dr. Siti Zabeda, Dr. Khairul Ridwan, and Dr. Nur Azila. So the questions that we have is, the patient comes to you asking for help to recover from pornography addiction. So what are the best measures to help him or her from this addiction? And this is the outline of our presentation. Firstly, we will introduce regarding what is pornography, and then the fatwa regarding pornography, the impact, solution, and conclusion to this question. So what is pornography? It is defined as any material that creates or increases sexual emotions or sexual thoughts. It has been used in English since the middle of 19th century, which comes from the Greek word of pornographos, writing about prostitutes. And initially it referred to visual or written matter designed to cause sexual arousal. Addiction to pornography is an act of watching or viewing pornographic material repeatedly, which is difficult to dispel by those affected. And this not among Malaysians, it does not involve only adults, but also involve minors such as teenagers. So the lifetime exposure among young people was reported in the range of 62% to 87%, with males starting at earlier school years, and it's used more frequently compared to female. There is an NGO in Malaysia named Malaysians Against Pornography, focused in raising awareness and advocate against the dangers of pornography, the need for age-appropriate sexual and reproductive education, and any relevant social issues. And they did a survey in 2018 and revealed that 80% of children aged 10 to 7 years old have watched pornography intentionally, and almost 89% of children aged 13 to 17 have been victims of online grooming. Then there was also another recent study 2 years ago, conducted among students aged 18 to 25, done in Penang. It showed that among almost 1,000 participants, the prevalence of lifetime pornography exposure was 74%, with more males compared to females, and they also start at an early age. The majority of person who watched pornography were alone and done at home, with internet being the major source of pornography. So this is one of the statistics by one of the biggest site that is known for this. So on the World Wide Web today, more than 4% of the websites contain adult content, and 20% of mobile searches consist of porn. 28,000 people are watching every minute, and that includes Muslims too. So it's pornography and its usage is increasing in our society, and that and the dangers that lie behind these addictions are endless. So Allah mentions in the Quran, tell the believing men to reduce some of their vision and guard their private parts. That is purer for them. Indeed, Allah is acquainted with what they do, and tell the believing woman to reduce some of their vision and guard their private parts, and not expose their adornment except that which is necessary appears thereof. So watching porn comes under the category of zina of the eyes. It is forbidden, and it will only have negative impact for us and our society. So the Islamic religion guides us on how to lower our gaze, as it saves us from committing sins and protecting one's private part. Not practicing this leads to watching porn or zina. So Abu Hurairah reported Allah's messenger says, Allah fixed the very portion of adultery which a man will indulge in. There will be no escape from it. The adultery of the eye is the lustful look, and the adultery of the ears is listening to voluptuous song or talk, and the adultery of the tongue is licentious speech, and the adultery of the hand is the lustful grip, and the adultery of the feet is to walk to the place where he intends to commit adultery, and the heart yearns and desires, which he may or may not put into effort. So the Quran has instructed Muslims to not even approach the act of fornication, as such acts leads to commission of this sin. And Allah says that, and not come near adultery, for it is shameful and an evil opening to the road. So getting addicted to pornography is easy. And once a man is enslaved to this desire, he gets trapped in it. He or she gets trapped in it is such that nothing else will excite him or her. So this means a Muslim gets away from his salah and remembrance of Allah. So there are many ways pornography can impact a society. So on family, it has significant effects on all stages of family life. For a child exposed to pornography within a family setting, it can cause stress and increase risk of developing negative attitudes about the nature and purpose of human sexuality. For adolescents, their attitudes towards their own and other sexuality change, and their sexual expectations and behavior are shaped accordingly. As for adults, it is harmful and even destructive, can have destructive effects on marriage. We increasingly see the institution of marriage as sexually confining. It diminishes belief that the importance of marital faithfulness, and have increasing doubts about the value of marriage as an essential social institution, and further doubts its future viability. So all this naturally diminishes the importance for them of having good family relations in their own families. The impact of parents' use of pornography on young children is varied and disturbing. It can eliminate warmth and affectionate family life, which is a natural social nutrient for a growing child. And pornography viewing among teenagers disorients them during their development phase, when they learn how to handle their sexuality, and this is the stage where they are most vulnerable to uncertainty about their sexual beliefs and moral values. As for society, exposure to pornographic sexual content can be a significant factor in teenage pregnancy. There was a 3-year longitudinal study of teenagers which found that frequent exposure to televised sexual content was related to substantially greater likelihood of teenage pregnancy within the succeeding 3 years. And some have lost their jobs, just like how some students have failed their exams for the same reason. Since pornography encourages sexually permissive attitudes and behavior, the users have higher likelihood of contracting a sexually transmitted disease. And this has also been shown to lead to increased sexual violence against women. Research has it that people who regularly watch porn have decreased empathy for violence against women. So we come to the solution for pornography addiction. Okay. So there are many ways which we can help this person to overcome his or her pornography addiction. So first of all, the person himself or herself has to have insight. So here comes self-effort. So to delete all content from all devices, installing content such as content blockers. So this makes access harder and facilitate recovery. To keep a journal and to identify triggers and what prompted the urge. Was it stress? Was it loneliness? And make a note of reaction towards the urge. This allows the person to take an objective look to their addiction. So make a list of pros and cons, writing down the reasons of like and dislike. This may help the person to see it as more negative rather than positive. He may become more mindful of the habit, and repeatedly reading the list to help remind the reason to stop. and to understand that devil takes advantage of human weakness and weaken our faith. So another self-effort is to restrain the gaze and not allowing to wander or dwell upon anything, such as refraining from looking at people's aura, refraining from looking into people's houses and things that are behind closed doors, refraining from looking at what people have of wealth, wife, children, and worldly goods. So of course, saying a prayer whenever there is urge to access porn can even make a prayer as computer home screen and phone lock screen background so that it is visible whenever the device is turned on. So another method of helping this person is to suggest group therapy, such as spending more time with friends and family members. Therefore, there'll be less alone time, build healthy relationships, and consider someone to open up to. There are support groups to help support friends, people with such struggles, to share what has been done and what plans, what to be done in the future. So in Malaysia, there is Sex and Love Addicts Malaysia for group group help. Thirdly, professional assistance is to treat the underlying mental health issues. For example, if the patient is depressed, therefore leading to seeking such activity. So if after consultation, maybe a psychiatrist, maybe the person should be started on antidepressants or can be suggested for cognitive behavioral therapy, and finally counseling. So as for children, of course, most importantly, we have our parents to have parents' role is very important in this scenario, to have open communication. This allows a child to be allows the child to feel safe to discuss sensitive topics, including pornography. And then the parents should set up parental controls on devices and internet browsers to restrict access to explicit content, to also teach children to critically evaluate media, including pornography, and understand its fictional nature. A comprehensive sex education can be given by the parents, and also lead by example, demonstrate healthy attitudes towards sexuality. So the conclusion from this topic is that this pornography is becoming an increasingly concerning issue worldwide. It is spreading among the young and old. If left unchecked, it definitely will invite many problems at personal, family, and societal level. So it needs to be eradicated, and the efforts to curb this phenomenon requires a concerted effort from all segments of society. It can be challenging to overcome, but if there's desire to change, healing is possible for everyone. And we as doctors should never neglect or turn our back away from this kind of situation. Thank you. That's the end of my presentation, our group's presentation.
Thank you, Dr. Gok, for the presentation. Panels, Prohamin, any comments?
Yeah, thank you for the topics that you are presenting. Is important for us. I think that you present covering quite well in terms of the addiction of pornography, which is I think this is how to say, is it endemic in our community now? It's not affected only the young people, but even there is a few studies that done shows that the elderly people also tend to have the addiction to the pornography, which is I think this is a lot of moral issue that need to be tackled here, not only in terms of the problem itself, but also how to overcome it in the global manner, which is involved the community. And then I'm glad that you give some suggestion in terms of the how going to eradicate the addiction. which is I think a lot of people need help, and then I think is as the medical doctor, and as a medical doctor, as a specialist who are going to be the leader in the community, you have to play a role, especially in the spiritual way as well as in the psychiatric input, how the things could be removed or to be cured, I think. And then I'm not really sure about the proper sex education will help in terms of these manners, but in certain extent, the input, the better proper ways of this one is indicated. For example, in the secondaries or the primary school, in which they need a proper way of teaching the sex education rather than they learn themselves from the internet, from the wrong way of this thing. And also, I think they need to emphasize it's like our hearts. We need to fill our hearts, ourself, our soul with something good. Then all these evil things that will come out from our heart, which is I think they need a more of a global or for the self-care, self-reflection, to remove all these things from the people. And then certain study shows that this addiction also leads to the violence and then crime things in the community, which is I think in terms of the governance of it, I think they need a higher authority to act in the proper way to overcome. For example, it's limit the internet access to the certain website or something, which is I think they have done partly, but they need to more emphasize or more penegasan or they need more authorities in terms of the getting it done in the proper way. So that is my comment, but I think this is going to be a community problem as well as the personal problem in terms of the pornography addiction. Thank you very much.
Thank you, Brahmin. Dato', any comment?
Yes, please. I see it from the Ghazalian viewpoint that the actions of man can be considered from two angles. One, that this behavior is an arid. An arid means it comes in flashes. It comes just for a while. That means that you are being overwhelmed by your lust and passion. So you need to release this. And how do you release it? That is why Islam encouraged the marriage among its followers. So even the hadith said that, "Oh ba'syara shabab, oh young people, oh youth, man istata'a minkumul ba'ah," those who are able to have the financial and the will and the energy and the power to do marriage, then get married, right? If he's not able to do that, then fast. Take fasting as the protector, because when you fast, you don't have the energy, that so on and so on. Because you can still perform, but the things that your passion and lust is not being feed with that. So it can be dealt in that sense that if it is arid, then like what Prof said, your heart must be there, your internal part, your intrinsic capability must be there on how to deal with it. Okay, so of course, in Islamic literature on fiqh, on legalistic opinion, there are stages, right? So they go to the minimum or the maximum, that perhaps instead of zina, it's better for you to masturbate, this sort of things and so on and so forth. So we don't want to declare it. So perhaps that is where it is not recommended. But if it comes to push come to Josh, then you might have to in order to release that for a while. Now the problem becomes for the person and for the society when it becomes a maqam. A maqam has become a behavior. It might become a behavior just through the fact that every time he feels the lust, he start to open up masturbation in order to encourage him to do masturbation, more satisfactory, and so on and so forth. To give him more impetus and this sort of thing. And this is one thing. So it becomes a behavior, and you find that most of them who have this will be facing even medical problem apart from the behavioral problem. And then when you have communities that have a lot of this affliction, then it will spill out into the community, and in the society you'll find that everyone is obsessed, right, with sex, obsessed with pornography, obsessed with so and so and so on, to the stage that if you look at the Western, if you open a YouTube and you look at the Western society right now, you find that because of the idea, because of the struggle of feminism and so on, going for the same right, they call it equality and so on and so on. If the male able to go and sleep with any woman they can find, regardless of the numbers, the women over there are now doing the same thing, and they say that is equal right. And now everyone is fighting to have body count, and as such, in order to increase this body count, they have their own TikTok, they have their own fans only sort of thing, and so on and so forth. Now it has become a social problem, and it started out with those sort of things. So I would say we have to identify that, and at the communal level, as far as public health is concerned, we have to tackle that obsession thing. And then for the personal level of when it comes as an RA, we have to have instruction even at school level, even at adolescent, mid-adolescent level. I don't know now is the adolescent period is so long, right? It started sometimes not at 10. And what they were mentioning in the West, you know, my daughter is 16, so I don't have to expect her to go dating until she's 17, and everyone was staring at him. You know, he's an artist, a Hollywood actor. And I said, what age are they going dating now? And somebody answered 12. The average age of dating in US now is 12, right? So then it becomes that obsession, then we lose it. That's it. We lose our society, our ethics, and we lose the family connection, and we lose the family unit. So I think we have to be serious about this. Thank you.
Okay, thank you, Dato', for the comment, also suggestion. I think we come to the end for our session for today. Group 18 is the last presentation. Alhamdulillah for the presentation for our groups. Inshallah, before we go for our closing remarks, I would like to get maybe some conclusion or feedback from all panels. Maybe it can be sum up what in maybe in 2 or 3 minutes regarding this course for the 2-day course. I think Dr. Osman can start first. Give some conclusion for our course for this 2 days course. What you feel?
Okay, this is an excellent course. Alhamdulillah, it's an excellent seminar, and just to show the broad amount of topics that is currently concerning both, I think, the society as well as the medical profession. So I think this was a good showcase of what young minds are interacting with. And I think the questions that were posed to the panelists was also relevant and extraordinary for this time. It's much needed. It's much needed to be thought about, at least at least as a starting point, I guess postgraduate studies is a point for thinking and a point for planting the seed so that later on when our graduates do enter community, they can contribute positively to society and be effective agents of change, and not only change for the sake of change, but change for the sake of spiritual as well as Rida Allah, Mardatillah in what they're changing. So I think this is an extraordinary course. Jazakallah khairan for inviting me to be as a panel. I benefited a lot from all of you. Barakallahu feekum.
Thank you very much, Osman. For Ibrahim, yes.
Yeah, I think very shortly, we appreciate that this is a customer as or the way of promoting knowledge adopted by Kulliyyah of Medicine. And I believe it is important to be continued and maintained, because as the scenarios being discussed here, addressing real issues, real practical issues, and the people get aware of it and get ready for that. Okay, this is number one. Number two, to develop the scenarios, may I suggest that it should be practical, maybe based on the questions or the practical things which happening during the practice, either clinical practice or in the hospital in general. So if few of them are made artificially by the creative mind of the examiner, most of them should be practical cases. Yeah, and should be covered also very controversial issues usually. And then see from Islamic perspective, and sometimes actually just medical ethics or bioethics perspective. Number three is I hope that our young doctors to be trained to how to solve these kind of things, which may you consider them as case-based research or case-based, which is leading to the taking decision. And this decision come from maybe two dimensions, mainly medical decision. That means what I should say when I encounter this problem as a medical doctor. Number two, also what Islam say. That is a decision from Islamic perspective. It is permissible, not permissible, halal, not halal, makruh. This is based on the case. Number three, of course, also maybe legal case, legal decision, legal. For example, abortion. Do Malaysia allow that or not? Of course, definitely Malaysia does not allow that. But in all cases, this also exposes our medical doctors also a little bit about the legal matters. What the Islamic, what the Malaysian law say about this. Okay, and so on. Thank you very much. I think it is very well done, and to be continued. That is my emphasis.
Thank you, Pak Ibrahim, for the comment and suggestion. Dato' Hamidun.
Thank you very much, everyone. It is a learning experience for me. There are a lot of issues, and all the panel has basically encapsulated what is supposed to be there in line with the Islamic scholarly principle of defining things in a jami' and mani' manner, including what's supposed to be included and throwing out what is not supposed to be there. So I've learned a lot, not only in the areas of new areas for me, but also in the areas of the Islamic part as well. And I can see the future needs for interdisciplinary approach so that we'll have new fatwa, or the new fatwa has got to come out, especially when we have later on when nanotechnology, when genetics things are coming in and so on and so forth. So thank you very much, Ibrahim, for that. My only thing that I would say to all of us here is that don't stop discovering yourself, meaning don't stop reading, don't stop being curious, don't stop trying to find answers and trying to make solutions to problems that we face. Thank you very much. Assalamu alaikum wa rahmatullah.
Thank you very much, Dato'. And last, Prof. Amin.
Jazakallah. Alhamdulillah. Alhamdulillah. I feel like I'm glad that we are having a good discussion, good presentation. Listen to the all lecture. Although I'm actually is not taking all the time with you all, but I think we have all the other experts panel, which is have a very bright and then good idea to sum up and discuss about whatever happened for the last 2 days. I think that we are moving forward towards improving in terms of the discussion, in terms of giving idea, try to analyze as well as formulate the solution for the different cases, different practical scenario that actually is facing by us, especially in the clinical doctor, the new going to be as a specialist. They are presenting quite well, although I think is a lot more room to be improved. But somehow you already put good effort in terms of give a discussion, suggestion, and then try to put this problem or the problem with the glass of or the spectacles of the Islam, and how the way that we are seeing things. I think inshallah they will move somehow. Then I echo others panel as well. I actually is every time we go through this kind of discourse, we learn a lot. We are having a good discussion. We are learn how to things, new ideas from the new speakers, everything. We learn what is the suggestion that can it be, especially that we listened this morning regarding the relationship between doctors and doctors, how they're supposed to be the team interaction. Okay, and we are listen to this one. I actually don't have the chance to comment on the how the interaction between the Sharia, the Islamic perspective, the religious and the technology science. This is need to be merged together so that we can have a better idea. For example, in terms of the milk bank that they are mentioned, Fiqh mentioned regarding the milk bank just now. Initially, in the fatwa, the milk bank actually is not allowed, but due to the certain studies, research, then further clarification of certain things. Then when we present it and we table it to the fatwa, the council, they actually is allow it, and then how we need to stringently or strictly make sure that they are following, especially in term of to actually is close the other loophole that like mahram actually is in term of the ibu susuan, adik-beradik susuan, or all these things actually is happening. And then this is what we call the contemporary fiqh that need to be dig and study again and again. So it's important for us to continuously do this kind of a discourse so that we can have the good growing of intellectual, growing of our Islamic paradigm in terms of our solving problem in this coming, which is we have the cloud futures in front of us, and then how we're going to clear it to make sure that they will be benefit to the mankind, inshallah. So I think that is about all that. Thanks to all the participants, all the expert panel, all the speakers who actually is having give your effort in terms of to grow this intellectual thought, which is I think is good, and the level actually is acceptable for the postgraduate. Thank you very much. Assalamualaikum warahmatullahi
Assalamualaikum. Thank you, Pramin. Thank you. Jazakallahu khairan katsira to our panels. Hopefully we can meet again next year. And also thank you very much to all postgraduate students for your cooperation, for your preparation of all this 2 days seminar. And without your cooperation, the seminar will not be coming like today. Okay, thank you very much. And I think we already share with you the feedback form. Kindly, all the postgraduate, please fill in the feedback form for you to have the certificate later. Okay, and then and also for the all medical doctor that want to have a MMA CPD, after this, I think after closing remark, we'll give you a QR code. So please stay here after the closing ceremony. Okay, I think thank you very much. And I would like to apologize for this session if any mistake from me. Okay, so I would like to give back to Dr. Shaiful for the closing ceremony.
Assalamualaikum and a very good day to all. Thank you very much, Dr. Shahrid. Actually, not a closing ceremony, just a closing remarks from me and also the organizing committee. I would like to thank our deep appreciation to all for joining this event until now, and I can see that number of participants is always above 100 since 8 a.m. yesterday until now. I would like to thanks to all the speakers, Dr. Hamidun, Prof. Amin, Dr. Usman, Prof. Ibrahim, because you guys stay until now, and also to the other speakers who are already with us since yesterday. And also would like to thanks to my committee members. Thank you for bearing with me, and thank you for helping conducting this event. I know that it's quite difficult in the beginning, but Alhamdulillah, we managed to do it today and also yesterday. I also would like to thank to all the participants and postgrad students because you guys still stay until today. And I know that some of you guys still working in the ward, still working in the clinic, but you managed to focus on the discussion. And I do believe that we covered a lot of topics since yesterday. We try to give a scenarios that can be related with clinical, and we try to give a general scenario so that we can cover both Muslim and non-Muslim. And I can see that the contribution will be contributed by all. And Alhamdulillah, I hope that we achieve this objective, and I hope that the message is not going to stop here and can be utilized and can be practiced by ourselves as well as the students during their practical session later on in their future specialist career. With that, I would like to invite my friend to share the QR code for the CPD points, and Alhamdulillah, we're going to reward 16 CPD points to all medical doctors. And thank you very much to all professors, Dato, and my friends. Thank you very much. Inshallah, we're going to conduct another event in future as well as this regular event annually next year. Inshallah, hopefully face to face.
Amin.
Thank you very much. Assalamualaikum.
Assalamualaikum. Thank you. Okay, thank you everyone. Assalamualaikum warahmatullahi wabarakatuh.
Dr. Zawani, are you ready with the MMA? Dr. Zawani? Dr. Azwani? Everyone kindly scan the QR code using your MSCPD Points apps, and we end our session with Suratul As and Tasbih Kifara.